Let's get are we online? Okay, great. Good morning. My name is Councillor Chris Moyes. I'm the Chair of the Board of Health. The clerk has confirmed that we have quorum, so I will call meeting 34 of the Board of Health to order. And welcome to those in the room and online. Today's meeting is being held by video conference and in person at City Hall in Committee Room Number 1. Because we are meeting in person and remotely, we ask everyone for their patience with any delays and technical issues. If you are registered to speak at today's meeting, please listen for me to call your name. I will call speakers in the order they appear on the list. The list of speakers can be viewed online by visiting the Board of Health page at toronto.ca/council and by clicking the speakers box for today's meeting. The clerk has provided all agenda materials on toronto.ca/council and via CMP, the clerk's meeting portal. Directors, please ensure that your video is turned on. Please keep your mic muted unless you wish to question staff or to speak on an item. As part of each agenda item, I will ask directors to raise their hand or unmute their mic if they wish to question staff or to speak. I will then create a speakers list and will call on directors when it is their turn to speak. When voting on an item or motion, I ask that directors raise their hand to indicate their vote. Directors, I want to remind you that you must submit and approve your motions by email. Staff are available at boh@toronto.ch to help with motions. The Board of Health acknowledges the land we are meeting on is the traditional territories of many nations, including the Mississaugas of the Credit, the Anishinaabe, the Chippewa, the Haudenosaunee, and the Wendat peoples, and is now home to many diverse First Nations, Inuit, and Métis peoples. We also acknowledge that Toronto is covered by Treaty 13 with the Mississaugas of the Credit. The City of Toronto acknowledges all treaty peoples, including those who came here as settlers, as migrants, either in this generation or in generations past, and those of us who came here involuntarily, particularly those brought to these lands as a result of the transatlantic slave trade and slavery. We pay tribute to those ancestors of African origin and descent. Are there any declarations of interest under the Municipal Conflict of Interest Act? If you have an interest, please raise your hand or unmute your mic and indicate the item number and the nature of the interest. Seeing none. Next, we need a motion to confirm the minutes from our last board meeting on June 1st, 2026. Director Chandrabalan, all those in favor? Opposed? Carried. Okay. So again, good morning to everyone. Welcome to the final meeting of the current term. I've been chair for 4 years now, I can't believe it. We have a full agenda today, so let's get right into it. Our first item of business will be an update from Dr. Murty on the 2024-2028 strategic plan. As you'll hear more about soon, we're very much on track with our strategic actions. It is through these actions that Toronto Board of Health continues to strengthen its preparedness and response capacity for emerging public health threats, including communicable diseases outbreaks and climate change impacts. Toronto Public Health also continues to invest in workforce development, employee engagement, and organizational culture to support a skilled, diverse, and resilient public health workforce that is ready to take on these challenges. Earlier this year, I brought forward a motion requesting the Medical Office of Health to review Toronto Public Health's role in indoor air quality. Today, I'm looking forward to receiving an update on this work, which I know is the result of the comprehensive research and stakeholder engagement. Indoor air quality will continue to be a pressing public health issue in the years to come, so our understanding of how we can mitigate negative health impacts is imperative. On a similar note, we have received a request from a review of the potential health impacts of introducing jets at Billy Bishop Airport through a member's motion at last month's City Council meeting. I know that the potential airport expansion is at the forefront of many residents' minds right now. My council colleagues and I have taken a strong stance in opposition to the exploration of lands, directing the city solicitor to explore our legal option in the matter, and calling on the federal government to use its position in the agreement to oppose the provincial government's plan. City planning have undertaken a review of the impact that expansion could have on housing supply. And when more information is available, Toronto Public Health will have an opportunity to contribute to our understanding of the total impacts of the proposed expansion by conducting a health impact assessment. As the province attempts to strip the city of involvement in their plan, we must use the tools we have available to push back. By conducting assessments that demonstrate the real impacts of the expansion would have on our residents, we build a strong evidence case to support our position. In addition to the extremely timely issue of the airport expansion, I am also bringing forward 2 new items of business that address emerging public health issues. The first item is about youth and digital culture. The Council of Chief Medical Officers of Health, the acronym is CCMOH, recently released a position statement on digital culture and child and youth well-being, which highlights growing evidence that social media, smartphones, and other online platforms can affect the health and well-being of children and youth. As the Board of Health has consistently supported initiatives that promote the health and well-being of children and youth, including extensive collaboration with local school boards. And the principles outlined in the CCMOH position statement align with this work. I am recommending that the board officially endorse the statement and that Dr. Murdy share the statement with school boards for consideration in the development of the next Toronto Health Schools strategy. The second item I am bringing forward today addresses the alarming trend in non-fatal overdoses we have seen over the recent months. In April of this year, there were 485 non-fatal suspected opioid overdoses attended by paramedic services, the highest monthly prevalence since 2021. These alarming figures are combined results of an unregulated, toxic drug supply and the forced closure of nearly all the safe consumption sites in Toronto. In my capacity as chair of our city implementation panel under the Board of Health, I have heard from frontline workers who are experiencing extreme burnout as they respond to several overdoses every day. Responding to these events, in addition to being both emotionally and physically taxing, takes community service workers away from their core job responsibilities. The data we have been dutifully collecting and monitoring at the city clearly shows that this is a crisis. And today, I am hoping that this board will recommend that City Council declare this crisis an epidemic in the City of Toronto. In addition, we at the city must step up to address these issues with the urgency they require. I am hoping that this can be done through the ongoing work of the interdivisional coordination table and engagement with the supervised consumption site closures working group. I'll speak to my motions more shortly, but in closing, I just want to thank public health staff, some of whom are here today, in particularly our frontline workers. Thank you for all that you do each and every day. Thank you to the clerk's team for supporting this board over the last 4 years since I've been chair. And also thank you to the board, my board colleagues, for your contributions to keeping our city healthy. And with that, I'll turn to Dr. Moody for her remarks.
I just wondered, are you going to, like, when we add, are you going to pre-circulate those motions so we can see them?
Yes, we can do. If we haven't done so already, we can do that for sure.
Chair, point of order. I just was wondering if there was consideration of reducing the deputations to 3 minutes. We have a lot of deputants today, and it might be better to just have them speak for 3 minutes.
Yes, you're a little ahead of me here, Councillor Chang. We are going to reduce the speaking time to 3 minutes. And I'm going to close the speakers list at 10 p.m. because we have, sorry, 10 a.m. Thank you. I don't know what date it is anymore. We do have quite a number of speakers on, I think, every item on the agenda today. Thank you.
Thank you, Chair.
Well, thank you, Chair Moyes, and good morning and welcome, everybody. Today is the last regularly scheduled Board of Health meeting leading up to the municipal election in October. Ahead of my prepared remarks, I did want to acknowledge the loss of life, injury, and loss of safety that occurred this weekend, including shootings at South St. Clair and North York. My deepest condolences to the family and friends impacted by this gun violence. There is no health in the city where we can't come together and celebrate as a city. I know we are resilient as a community and will take back the streets and recommit to fostering places where people can go, enjoy themselves, and not worry about violence. So much of the work of public health is about recognizing the social determinants of health that lead to conditions of despair and desperation and can contribute to outcomes that we saw this past weekend. I know we can do this better because Toronto has shown this time and again that we can do it better. More recently, over the Pride weekend, I was fortunate to be able to attend the Street Festival and march in the Pride Parade, an example of community coming together, showing diversity of experience, showing that Toronto Public Health Pride activities are designed to reduce stigma, increase awareness of available public health programs and services, and encourage people to take proactive steps to support their sexual health. My thanks and appreciation to the sexual health promotion team and the work they do during Pride and throughout the year. This summer, we're also continuing our This is Public Health campaign that focuses on educating Torontonians on all the ways public health is connected to our daily lives. This summer, our ads are focusing on prevention of West Nile virus, Lyme disease, and heat illness. In addition to this campaign, Toronto Public Health has garnered a tremendous amount of earned media with a number of public health stories hitting the news cycle. We have been involved in a number of infectious disease response efforts and conducted a variety of case and contact investigations related to measles, mumps, and Legionnaire's disease. We're also working with our provincial and federal partners to respond to international cases and outbreaks of hantavirus and Ebola. More recently, we provided information on beach water quality safety and outbreaks of cyclosporiasis. We've also had to issue a drug alert and provide information on the ongoing toxicity of the drug supply. This is public health. This is what we do every day to keep everyone who lives, works, studies, and play in our city safe and healthy. Since we met last, we've also been actively responding to the city's heat response. This year, we had our first heat alert in May, and throughout the summer so far, we are now into our third heat alert being declared yesterday for today and early this week. We have been working diligently with city and community partners to reduce the risk of heat-related illness. While we did see spikes in the number of emergency service calls and heat-related visits to the emergency department during the Canada Day week heat alert, those numbers could have been significantly higher without the mitigation steps we had in place. And as a reminder to everyone this week in our another heat alert to take advantage of those cooling options. You will hear later this morning that climate change is one of the many areas of focus of Toronto Public Health's 2024 to 2028 strategic plan. Earlier this year, we launched our climate change dashboard to better understand how our evolving climate is affecting our health and our planet. The dashboard helps us see the long-term public health impacts of climate change and how they can help us better make policy decisions, set priorities, and develop interventions to reduce the overall burden of climate-related events on our residents. The strategic plan serves as our guiding blueprint to help the organization navigate key priorities, such as these to ensure continued delivery of high-quality programs and services. The strategic plan lays out an ambitious vision, a city where all people can be healthy and thrive. This is the guiding principle of all we do at Public Health and will persist in doing. As we're heading into the second half of July, I'd like to take a moment to recognize World Hepatitis Day on July 28th. The goal of this day is to raise awareness about viral hepatitis, encourage prevention, screening, treatment, and to speed up our efforts towards eliminating hepatitis B and C as significant public health concerns. Today serves as a reminder that hepatitis C is now a curable condition, and hepatitis B is vaccine preventable and can be managed. Elimination is within our reach if we act with intention. It is estimated that many people are unaware that they have hepatitis B or C infections. Both infections may progress silently, without symptoms, for many years, leading to cirrhosis, liver failure, or liver cancer. But these outcomes are largely preventable with testing for those at risk of infection and treatment. Toronto Public Health helps to prevent hepatitis B through school vaccination program and provides outreach testing for hepatitis C to individuals at risk. Funding programs like the Toronto Public Health Toronto Urban Health Fund are a key part of moving towards elimination, but ensuring that our healthcare pathways for treatment and support. Tough funded projects contribute to the prevention of hepatitis infection by complementing other TPH programs and services like sexual health, substance use prevention, and harm reduction. Through these and other projects, we will continue to work with healthcare and community partners to reduce barriers, meeting people where they are and ensuring that elimination efforts are grounded in equity. Together, we can move closer to hepatitis elimination. This Sunday, July 19th, will mark the end of the FIFA World Cup in 2026. The excitement this tournament has brought to the city over the past 6 weeks has been unlike anything we've seen before. Although Team Canada did not advance as far as many of us had hoped, many of us enjoyed watching them play and some great football, and certainly made us proud. Toronto Stadium, FIFA Fan Fest, and the Last Mile, as well as the restaurants, bars, parks, viewing parties, and spaces throughout the city have all been awash with excitement and activity as we celebrated teams from around the world. These celebrations would not have been possible without the work of the City of Toronto staff to create safe and healthy spaces and make hosting a success. I'm especially proud of the Toronto Public Health team who are continuing to support the FIFA efforts in various capacities, whether it's on the field, the Joint Information Centre, the Toronto Emergency Operations Centre, the Toronto Area Command Centre, in Toronto Public Health Divisional Operations Centre, and more. As we look ahead to the rest of the summer, I hope you have a chance to continue enjoying all that Toronto has to offer. Here at Toronto Public Health, we are already planning for the rest of 2026. Before we will meet again, we have resumed our back-to-school activities, such as immunizations and school nutrition program. We will have launched promotion and offering of flu shots and COVID vaccines for the respiratory season. And as always, we will be doing the work that keeps the people of Toronto safer and healthier every day. Thank you.
Thank you, Dr. Murdy, for your remarks. Now I'm going to introduce 2 new items to the agenda. I'm going to ask the clerk to post the first one. I will move it. I know the system's a little slow. When I chaired Toronto East York Community Council earlier this week, the system was also slow back then too. Here it is. So this one is the endorsement of the Council of Chief Medical Officer of Health position statement on digital culture and child and youth well-being. All those in favor? No, to add it to the agenda. Yes.
Just to add it to the
Yes,
agenda?
yes.
Okay.
All those in favor? Opposed? Carried.
Can't hear you here, Mr. Chair.
Sorry.
Be a little louder.
Okay.
You just turn on your mic.
That was carried. The second item is declaring the drug toxicity crisis and epidemic. In my opening remarks, I said this was going to council. It's actually not going to council. There's a slight amendment in that the medical officer of health would work with the deputy city manager to implement the recommendations here. So all those in favor to add it? Opposed? Carried. Thank you. And now I'm going to move a motion to limit speaking time to 3 minutes, and I'm going to close the speakers list at 10:30. Just waiting for it to be posted. Okay, all those in favor? Opposed? Carried. Thank you. All right. So we now have 7 items on the agenda for today. The first item, HL 34.1, Toronto Public Health Strategic Plan 2024 to 2028, 2026 Annual Progress Report. There's a staff presentation on this item, so I will hold it down. Next item is HL 34.2, 2026 Board of Health Procedures Bylaw Review. Anyone want to hold that? I move that. Oh, there's a speaker? Actually, where's my speakers list? That's. Is there a speaker on this item? There is now. Oh, there is now. Okay. We'll hold that down for speakers. A speaker. HL 34.3, responding to the Constance Lake First Nations Coroner's Inquest into Blastomycosis Outbreak death or deaths. I don't see any speakers on this item. So you have a few questions? Okay, Director Medor, we'll hold that down for you. 37, HL 34.4, Public Health Role in Indoor Air Quality. There's a presentation on this item, so I'll hold it down. HL 34.5, investigating the increased risks of heart disease, lung cancer, and tumors from bringing jets to Toronto's waterfront communities. Many speakers on this item, and I will hold it down for that reason. And I think the rest of the new items, right? Yeah, okay. And they are, I will hold them down. There might be speakers on them. Over. And again, the speakers list is open until 10:30. Okay, so we'll go to HL 34.1, Toronto Public Health Strategic Plan 2024-28. Dr. Murdy, I think you're the one presenting on this item. Go ahead.
We'll just wait till the presentation comes up. Am I presenting? Am I projecting? Am I projecting or? Is it shared? Okay. Okay. Good morning. I'm pleased to present Toronto Public Health's 2026 Strategic Plan Annual Progress Report. This report highlights progress over the past year in advancing the 2024 to 2028 Strategic Plan and key initiatives that demonstrate the plan in action. Next slide. The strategic plan is grounded in our vision of a city where all people can be healthy and thrive, and our mission to protect and improve health at a population level while reducing health inequities. It is organized around 5 priorities that, together with the Ontario Public Health Standards, guide Toronto Public Health's programs and services. The Strategic Plan Progress Dashboard remains a key tool for tracking, implementation, and demonstrating transparency and accountability for our progress across all 22 actions in the plan. Updated this past spring, 2 actions are now complete, 19 are on track, and 1 is upcoming, demonstrating strong overall progress on meeting the outline. I'm pleased to profile examples of initiatives that demonstrate how Toronto Public Health is implementing the strategic plan in practice. Under Priority 1, Toronto Public Health works to strengthen health protection, disease prevention, and emergency preparedness, including in response to emerging risks such as climate change. A notable achievement this year has been the development and implementation of a climate change surveillance framework. In March of 2026, we launched the Climate Change and Public Health Dashboard. This tool brings together up to 10 years of health and environmental data to help us better understand how climate change is affecting the health of residents over time. The initial release of the dashboard includes indicators on heat and cold, vector-borne disease, severe weather, air quality and wildfire smoke, UV radiation, and food and water safety. Looking ahead, we will work with partners to expand surveillance indicators, strengthen our ability to identify health inequities related to climate change, and enhance communications to populations vulnerable to extreme heat. Under Priority 2, Toronto Public Health is committed to promoting health and well-being across the lifespan, particularly through chronic disease prevention. Physical activity is a key driver of chronic disease prevention. As such, Toronto Public Health is implementing school-based initiatives to promote physical activity and reduce sedentary behavior among children, such as the Playground Activity Leaders in Schools, or PALS program, where students are trained as peer leaders to increase opportunities for movement and physical literacy. We are collaborating on initiatives to raise awareness about the growing impact of digital culture and promoting the importance of reduced screen time. We're also contributing to research and advising on initiatives to strengthen environments to support older adults to age in place. Looking ahead, our focus will be on developing a movement promotion strategy, examining inequities that contribute to reduced levels of physical activity, and continuing to build multi-sectoral partnerships. Under Priority 3, TPH promotes the conditions to support positive mental health and reduce the harms of substance use, including strengthening trauma-informed public health services. This work is aligned with the key city and provincial strategies, including work focused on early adversity and upstream prevention. Toronto Public Health's initial focus is building organizational capacity through training. We are expanding trauma-informed care training to all TPH frontline staff this year. This training aims to build a deeper understanding of the widespread and long-term impacts of trauma and violence, while strengthening staff capacity to respond in ways that promote safety, healing, empowerment, and trust. Toronto Public Health has established an internal community of practice to facilitate ongoing adoption of trauma-informed care across the organization. Looking ahead, Toronto Public Health will advance a coordinated trauma and violence-informed approach across city services in partnership with other city divisions. Under Priority 4, Toronto Public Health continues to advance health equity by strengthening how we identify and address the needs of priority populations. Collecting and assessing sociodemographic data helps Toronto Public Health understand who is being reached, identify underserved groups, tailor programs, and evaluate health equity impacts and outcomes. In November of 2025, Toronto Public Health began to roll out sociodemographic data collection at a breastfeeding clinic. There's been strong interest with over 200 clients participating. Early insights show meaningful variation in race, income, and immigration status. Looking ahead, Toronto Public Health is exploring how these insights can inform program planning, for example, by identifying differences across clinic populations, helping to better assess outreach needs. Toronto Public Health will continue a phased expansion to additional clinics and services. We will continue to strengthen sociodemographic data governance, including advancing community-led data governance, particularly with Indigenous and Black communities. Our ability to advance public health depends on a skilled, supported, and engaged workforce. Under Priority 5, Toronto Public Health is making efforts to nurture a positive workplace culture. Toronto Public Health is implementing its Employee Engagement Action Plan, focused on strengthening communication, enhancing senior leadership engagement, and expanding staff learning and development opportunities. In 2025, TPH partnered with the Toronto Employment and Social Services and Toronto Shelter and Support Services to participate in the Black Staff Mentorship Program. The program supports career development and advances the city's commitment to addressing anti-Black racism. The program will be continuing into 2026. Looking ahead, Toronto Public Health will continue to apply a data-driven and continuous improvement approach to employee engagement and strengthen our ability to respond to staff needs. Finally, Toronto Public Health will continue to implement the strategic plan, advancing the 22 key actions and strengthening strategic alignment across programs and services. Progress will continue to be monitored through semi-annual updates to strategic plan progress dashboard, where the next dashboard update is anticipated in the fall of 2026, as well as annual reporting to the board, and we will next report to the board in 2027 with our annual progress update. Thank you.
Thank you, Dr. Murdy. We do have 9 speakers on this item. First up is Brooke Coatsworth. Brooke Coatsworth. Online.
Sorry, Chair, point of order. Do we need to move a motion about the length of the deputations?
We did already, Councillor
we
Chang.
did?
Yes.
Sorry, I missed that.
It's okay. It's Monday. I'm very forgiving today. Exactly.
Hi, good morning.
3 minutes. Go ahead.
Thank you very much. As a parent and resident of Toronto, I want to spend some time. I've spent some time over the weekend reading the reports before you guys today and the board. And one thing really stood out to me, and no, I'm not here to talk about the increased risks from bringing jets to the Toronto waterfront. I'm here to talk about what I can only describe as a political agenda that Councillor Moist has mentioned in the intro about the beautifully collected data around the illegal drug crisis in Toronto. But first, I need to create an equal foundation for the deputants today and a safe place for Torontonians to express themselves with the taxpayer acknowledgement. Let's reflect and remember that every word spoken in this chamber, every light bulb, and every salary paid, including those of city councillors, is funded almost entirely.
Can you speak to the item before you, please?
I've got 3 minutes, Councillor.
Yes,
Thank you very much.
So you need to speak to the item, Toronto Public Health Strategic Plan. That's what we're speaking to.
I am. And that is a taxpayer-funded plan, and you've just wasted 15 seconds of my time. I'd like that back, please. Thank you very much. Nearly all of the city's $18.9 billion budget comes directly from us, the taxpayers. We acknowledge that while taxpayers and property owners have endured almost 20% increase in the last 3 years, only a small and insulated group decides how much of their income is expropriated to sustain a burgeoning municipal bureaucracy that continues to grow regardless of outcomes and results. We pay respect to those taxpayers because without them, this institution could not indulge in the ideological excess like renaming streets and public squares, painting roads with inferior and environmentally damaging red paint, nor fund harm reduction programs that result in a steady stream of drug paraphernalia littering our streets, sidewalks, parks, and playgrounds. In the spirit of acknowledgement and with the eye to the future, we recognize the Toronto taxpayer and revere their tolerance for being taxed. Thank you. Now back to TPH Strategic Plan Progress Report, speaking to HL 34.1. You're welcome. Toronto Public Health has become very good at measuring what happens inside its programs. I want to cherry pick on one program being praised today, the Downtown Community Outreach Response and Engagement Team. The core evaluation measures contacts, referrals, outreach, and engagement. Your strategic plan measures partnerships, initiatives, and actions completed. Those are all worthwhile measures. But what about the communities around those programs? All the communities, most specifically the taxpayer communities. Questions such as, did neighborhoods become healthier? Did public confidence improve? Are families using parks and public spaces more? Are businesses seeing the same improvements that your reports describe? Those questions seem much harder to find answers to. Does TPH board, most specifically the councillors on the board, care about their constituents, about taxpayers in their ridings? The same is true of many discussions around harm reduction. The research carefully measures outcomes for people using services, but gives less attention to the broader community where those servers operate. There is never any mention of drug dealers feeding the illegal drug supply. It's a Monday, and creating an environment that is deteriorating city.
Thank you.
Frontline workers. I'd like my 15 seconds back. Thank you very much.
Thank you so much for deputing today. Any questions for the deputant? Seeing none.
That's rather rude, Councillor Moist. Good luck with your ideology, my friend.
Thank you so much.
Have a great day.
Next up is Naz Yadolahi.
Oh, here we go.
Thank you. 3 minutes.
Good morning, Chair and members of the board. My name is Naz Yadolahi. I'm president of QP Local 79, where we represent hundreds of public health workers and inspectors, health promoters, and staff who carry out the work that this report describes. We recognize the goals in this strategic plan, which include strengthening public health in many different areas. On health equity and harm reduction, we want to note that Toronto Public Health ended its own supervised consumption services last year, and that several other supervised consumption sites in Toronto have since been closed under provincial defunding, leaving only a small number still operating. We urge the board not to lose sight of that loss as it advances this priority. I want to focus my time on workplace culture because I think this report leaves out something important. Under that priority, the report describes engagement surveys, leadership town halls, and mentorship programming, but it references the nursing recruitment retention strategy only once, as a title in a table with no discussion of what it found or what it means for retention. That strategy came before this board at the last meeting where Local 79 presented research on the direct connection between compensation and the city's ability to retain experienced public health nurses and inspectors. We thank Councillor Chang for her questions at that meeting, which helped surface how directly this affects service delivery, and we want to acknowledge that Labour Relations staff clarified something incredibly important, that this board has the ability to request a budget increase to address wage adjustments. I have supplied Dr. Murty on a number of occasions with comprehensive research which highlights how far the City of Toronto has fallen with its compensation with regards to its counterparts in neighbouring municipalities. This report also lists Action 20, launching a formal succession planning framework, as on track, though it offers no detail on what that actually looks like. I would like to ask that this board ensure that when it does take shape, compensation is built in from the start rather than addressed separately or later, so that a succession plan doesn't end up developing staff without addressing whether their wages are competitive enough to keep them. We all in this room are familiar with the budget process and understand how it works, and we hope that it will be utilized to remedy workers so that we can keep them. Finally, a point of clarification for the record. Local 79 did propose significant wage adjustments for public health nurses during our last round of bargaining with the city. However, those proposals were not accepted and it was not a priority by the city. We are raising this with the board now because the underlying concern about public health nursing pay has not been resolved through this process or that process, and because retention in these roles is a public health issue within this board's mandate.
Thank you so much.
I'd like a couple more seconds just to finish, please. We'd ask that the board direct the compensation be explicitly addressed as the succession planning framework is developed, and that it consider using the budget mechanism Labour Relations has identified. Thank you. Happy to answer questions.
Any questions for the deputant? Seeing none. Thank you. Karen Rukas.
Hi, Council.
Good morning.
Is this speaking here? Is that good? Okay.
Yeah, 3 minutes.
This morning, I'd like to address the strategic plan, specifically promoting health and well-being across the lifespan vis-a-vis the risks of the COVID-19 vaccines, which are still being administered to babies, pregnant women, and seniors, and the ability of deputations to convey those risks, or any dangers for that matter. Are these deputations effective, or are we just going through the motions? I feel that this deputation process is failing us, and even by reducing us from 5 minutes to 3 minutes after my speech is 5 minutes, tells it all. While the deputants are screaming at the top of our lungs, telling this board about the dangers of the mRNA platform, yet all of you are looking down. You dare not look up, because if you look up, you'll see the truth. And for some reason, the truth scares you. It scares me too. Yet there's a larger problem in this room. There appears to be no professional curiosity around what we're telling you, whether it be about the contamination of the vaccine with SV40, a known cancer agent, or the E. coli DNA, or the myriad of adverse events and deaths caused by the vaccine. If I were to trade places with you, I hope I'd be asking these kinds of questions. Could DNA contamination affect my DNA? Could this impact fertility in our society? Could it cause cancer, or worse, death? How many people around the world has the vaccine killed? I'll tell you, 17 million. Which jurisdictions have stopped the COVID-19 vaccine for healthy individuals, including pregnant women? That'd be Germany, Denmark, and partially UK. In your place, I might even be so bold as to ask if we could arrange a panel of scientists and doctors from around Canada, perhaps around the world, to provide this board with a fulsome presentation on the mechanics of the mRNA vaccine and its sequelae. I'd be happy to arrange that. Where are those questions? Where is the curiosity? Remember, when people feel unheard, trust erodes, and public health depends on trust. But you might all here tell me, well, you know what, we're just following the advice from Health Canada. But did you know that Health Canada is simply following the rhetoric that is provided to them by the manufacturers, namely Pfizer and Moderna? How do we know that? We know that through Freedom of Information requests. But the former CDC director, Dr. Robert Redfield, is not going to be quiet. He is now letting everyone know that he no longer recommends the COVID-19 vaccine for any of his patients. He has seen far too many serious injuries, as did Dr. Charles Hoff in British Columbia, along with so many other doctors in Ontario and across Canada and the world. Dr. Redfield explains that the most toxic part of the vaccine is the very protein that the mRNA instructs your body to make, the spike protein. He explains that those of you who have had the mRNA vaccine have become spike-producing factories. His words, not mine. Look them up.
Thank you.
Thank you very much for your time.
Thank you. Any questions for the Deputant? Councillor
Thompson.
Thompson.
Thank you, Mr. Chair. I realize that's Monday through you. Thank you very much for your presentation. So, obviously, there's great amount of research on both sides. And based on your presentation and based on the information that we have as obviously councillors and members of the Board of Health, we are adhering to the information that's coming from Health Canada and so on. That is primarily the information that we gather. You're here to say what to us this morning in terms of a sense of fairness as it relates to information. So, based on your presentation, what actions is it that you're hoping that this Board of Health will take in order to transition the changes which I gather you're trying to seek?
Okay. So just a couple of things, and if this is a strategic planning meeting, first of all, I'd suggest that you wouldn't ever reduce constituents to 3 minutes. 5 minutes is not enough. I would suggest an entire day of deputations where you allow people to speak for 5 or 10 minutes and then have another 10 to 20 minutes of questions so that at least we feel we're being heard. And you might have a question about SV40. You might have a question about the DNA contamination. How do we know this? There's a lot of information out there. Secondly, we have a call to halt program. There are many jurisdictions around the world that are halting this vaccine because they now realize that not only is the spike protein dangerous, but so are the lipid nanoparticles. They're toxic. And that's what helps that product to get into every organ in your body. You weren't told that. You were told that it stays in the arm and goes to the lymph nodes. That's what you were told. That's not the truth, as per a brilliant Canadian who asked for the Pfizer biodistribution studies out of Japan. And there we found out that most of it goes, believe it or not, to your ovaries, your testes, and it goes to every organ in the body. Hence, we have myocarditis. All I'm saying is we have created a real mess with this vaccine. It is going to increase, and it has already increased, the problems in healthcare that we're experiencing. I have a 19-year-old boy who got myocarditis and has had a defibrillator implanted in his chest. We had a 56-year-old friend who took the Pfizer, went to bed, never woke up.
So just one final question. I appreciate
Go ahead, sure.
So can you tell us a little bit about you in terms of your background to help us understand how you formulated some of these thoughts and ideas, please?
So I'm a retired occupational therapist. I ran 2 companies, sold one of my companies to an American firm. And for the last 6 years, I have been involved with the Canadian Citizens Care Alliance, which was the Canadian COVID Care Alliance. I've been working with the physicians and scientists from across Canada and some like Dr. Latipo in Florida. And others around the world.
Thank you. 3 minutes is up. Thank you very much.
I appreciate the questions.
Thank you.
Thank you so much.
Thank you, Mr. Chair.
Yes. Next up is Matthew Nicol. Just swipe until the green light is on for your mic.
It doesn't show us on the screen yet.
It's going to come up.
Okay, cool. All right. Can you hear me?
Yes, 3 minutes.
Okay, so I titled this Toronto. Going to display? Is it? What? There is another one here. There we go. Cool beans. All right, Toronto Public Health Strategic Plan and its relationship to the Nano Bio Info Cogno experiment. So, we'll start off with priority 1, dealing with pandemic preparedness and climate change. So I introduce you to Crystal Vander Elst of Policy Horizons, a policy arm of the Canadian government. She's also a member of the IEC, an international standards organization. Everybody follows international standards everywhere, all levels of government. So the COVID-19 pandemic created an opportunity for real-time biosurveillance via smartphone. And there was also development of the mRNA synthetic biology gene experiment. Our gene therapy experiment, and this is all part of the biodigital convergence, which is a merging of biological life with digital components. So from Mars Discovery District here, I'll introduce you to digital twins, which basically include virtual models, in this case for medicine for entire bodies, and digital twins, AI and cloud computing technologies are used entirely by the global market. Run with it Synthetics deals with geospatial digital twin technology for emergency preparedness. And then we get to Francois Collier, the head of the Standards Council of Canada, who's a member of the ISO and IEC. So a digital twin deals with data connections that converge physical and digital states to synchronize them, and real-time, real-world data measurements are measured through sensors and transactions, and digital twins enable smart everything. Internet of Things, how devices connect to each other, like your phone or your car, for instance. This is where you deal with sensors in a smart city and cloud-based telemetry. Canadian Moonshot program here, AI as a tool for data analysis, gets into several avenues from food security and agriculture to remote connectivity, pharma development, neuroscience, cancer, biotech, quantum computing, and climate change modeling. Suzanne Brandt of the First Nations Technical Institute in Tyendinaga. Climate change is mentioned in this document, as well as the mRNA COVID gene therapy. And basically, the way that she talks about preserving the land is through 3D bioprinting meat and agricultural products, hence the term synthetic biology, which is exactly where the mRNA shot falls under. So here, the next one we get into is reducing chronic and infectious diseases. So that's where CRISPR gene editing therapy comes into play, which is used for cancer, immune problems, and supposedly fighting viruses. Now we look at mental health. So you deal with tracking human health in real time through wearables and AI tracking moods and mental health through voice and facial expressions. Neurotechnology refers to tech providing insight of the brain or nervous system and function, and neural network computing through computer vision and analysis detects emotions and moods, and proactive software agents discern and predict likely future needs. Jennifer Chandler of the University of Ottawa here is Canada's research chair in law and ethics of brain technologies, and she's also part of the IEEE neuroethics framework. In hybrid minds here, this project.
Thank you. Thank you. Any questions for the Deputant? Seeing none. Thank you. Councillor.
I don't understand what you were saying. What were you saying? You said a lot, but I just didn't understand it. What were you saying?
So all international international standards are relevant anywhere and everywhere, including the City of Toronto. And all international standards are built around this biodigital convergence. This is relevant to Health Canada and various organizations. So my concern for you now to finally answer your question here is why is, in particular in Toronto, why are Toronto residents not aware of the biodigital convergence? And did they consent to this experiment? Because I did not consent to have digital components merged with my biology.
Thank you.
Thank
Very
you.
helpful. Thank you, Mr. Chair.
Thank you.
Thank you.
Joseph Layu. Three minutes. Is this your device?
Yes. So I have to pull up my file and just give me a minute. Thank you.
Okay, 3 minutes. Time has started.
Okay, good morning. Today I want to talk about the climate change surveillance system. I find it very interesting, to look at
The
climate
mic
change.
on? Is the green button on?
It's already green.
Just speak closer to the mic.
Okay. Okay, good morning. I would like to speak about the climate change surveillance system. I find it interesting. We can look at the climate change and see the health impact. So I look into this thing, and there are few indicators, and I'm more familiar with temperature, which is the global warming. And I look at it into the dashboard. I find that there are two inputs: the number of heat warning days and the rate of heat-related emergency department visits. And it carries about 11 years of data. This surveillance system is good because it gives us the chance to do some kind of evidence-based practice, as well as data-driven decision-making. So we can based on facts instead of based on our intuition or some kind of old tradition. So I look closer into the system, and I'm confused. When we talk about climate, we talk about maybe at least 15 years of intervals. But this chart only carries about 10 years of data. So I think it should be called weather change surveillance instead of climate change. And then it is also challenging to do it in Toronto because it's very small. It's a microclimate. And I think a lot of factors like carbon footprints or something like this may not be the contribution factor to the health impact or to the change of so-called local climate. And also the city is changing very fast, the demographics and stuff, and practice and habits. So I'm not sure if we can really get something useful from this kind of system because one side is changing too fast and the other side is really long intervals. And I think the data-driven approach is cool, but I don't always find it comfortable because a lot of times the data they don't reflect my feelings or intuition, and a lot of times the decisions are not really human-centric. And there are a lot of examples, and I think we all experienced this. This is data-driven, evidence-based, but I cannot make sense of them. And also, like this data-driven approach, like is so-called objective, but there is always these underlying principles, like they have data, metrics, and models, and they are designed by the designer.
Thank you. You have 3 minutes.
Thank you very much.
Any questions for Deputant? Seeing none, thank you. Alma Marine Lorena?
Yes.
3 minutes. And the green light is on. Whenever you're ready. Just swipe until the green light is on.
Okay. Okay. Good morning, Councillor Moyes and members of the Board of Health. My name is Alma Mariñel Arena, and I am City of Toronto Public Health Nurse working in Control of Infectious Diseases team. I am here today to highlight issues that must be addressed to ensure the goals in Toronto Public Health's strategic plan and achieve. The first item that I want to highlight is the strategic plan report is priority 3, which commits TPH to reduce the harms of substance use. I want to draw attention to the objective to deliver public health interventions that respond to the drug toxicity epidemic. If the city is serious about this objective, we need city leaders to be bolder. We need you to explore all funding avenues to allow these sites to reopen and stay open. Otherwise, we know that more people in Toronto will die preventable deaths. As public health nurses, we will see the impact of these closures in our work and urge the board to listen to the evidence, to public health professionals, and to community advocates. I also want to speak to the objective to develop and retain a skilled and diverse workforce. Senior PHNs in Toronto are paid far less than all other municipalities in the Greater Toronto Area, despite the larger and growing public health challenges that come with working in a major city. We know that this is a retention risk. There are 20% fewer public health nurses in Toronto than before COVID-19 and fewer public health inspectors too. In the last meeting of the Board of Health, a labor relations representative clarified that the Board of Health can request a budget increase to bring PHN wages in line with other municipalities. If TPH is to meet its retention goals, I urge the board to act on this. As a public health nurses, we do not just have one patient. Our patient is the whole city of Toronto, is all of us, is you and each of us. But to care effectively for our city, we need to be supported by city leadership. That means investment, both to protect harm reduction work and to retain the workers who keep Toronto safe and healthy. All of us, thank you. I welcome any question and comment.
Thank you very much. Go ahead, Councillor Thompson.
Thank you. Thank you for your presentation this morning, ma'am. How much more should we be investing?
How much more?
Yeah, you said you welcome the investment, so I imagine that you have a number.
Well, we are 20% less. We are like about $10,000 less per each individual in comparison to other municipalities, so at least we should be at pair.
$10,000 more.
Well, at least that's to be up to the other municipalities.
So is that the ceiling or is that the floor?
That's the floor.
That's the floor. And so what's the ceiling?
The sky is the limit, though.
That's very helpful. Just in terms of, we talked a little bit about the resources from the investment and monetary, but what are some of the other issues that you as a public health nurse, sort of when you look strategically, as part of the plan that really needs to be addressed to ensure, for example, that when you come to work, aside from the money, right? When you come to work, you're happy, your colleague and yourself are working on the patient Toronto, which is all of the people in Toronto. What makes you happy to know that either that you have an environment where your superiors are collegial, an environment where you're just happy to come in? What are some of the things that may not be included or you need to amp up or ramp up as part of the strategic plan? Can you tell us what those are?
Can you clarify, what do you mean?
What makes you happy coming to work? What makes you, I don't know, what makes you happy coming to work? Is it money?
Money is part of it, yes, of course. It's a big deal to be well paid.
What else?
It makes me happy to make a difference, to take care of whole Toronto, to know that the spread of diseases is controlled, to know that people are not going to be dying because it wasn't done and I didn't have backup from other colleagues, and to know that my colleagues are not staying home sick because of burnout and being unable to pay their bills.
And I'm trying to ensure that in terms of your colleagues staying home, not being well, do we provide enough of the vehicle to ensure that they're well, absent of the financial piece?
To what? To an extent, yes.
What more should we do?
I want to focus on the fact that we are short on our salaries and wages, and that affects directly everything.
Thank you. So it's about the money.
Part of it.
Okay. Thank you, Mr. Chair.
Thank you. Okay. I have a question. Sorry. One question for me.
I have another question.
Sure.
Thank you for coming in today. How long have you been a public health nurse?
I have been at public health for 10 years. I work at Toronto Public Health for these past 10 years. And before joining the City of Toronto, I was a primary healthcare nurse at Sherbourne Health Centre, where I work with newcomers to Canada, members of the LGBTQI community, and on-house residents in the area of Toronto. That experience was the one that brought me to have acute understanding of harm reductions and working with on-house people and people with tuberculosis. So that's why I ended up joining Toronto Public Health, first of all at TB, and now on communicable infectious diseases. So
well, that's
10
great.
years.
I know Sherbourne Public Health very well. And
yes, I was there for more than a decade before moving to TBH.
That's incredible. And so where in the city do you work now?
I am at Metro Hall at the communicable infectious diseases. So I work along with public health inspectors. So we do communicable diseases, we do outbreaks, we include hepatitis A, E. coli, Mpox, measles, and many others. So we investigate cases and identify contacts, coordinate laboratory reports, organize vaccination clinics, conduct home visits, when we need and more. So they're just part of it. So that's what I do every day. It makes me very happy to be at this work, and it's not all about money. I wouldn't be a nurse for more than 2 decades if it was just for the money. Thank you.
Yeah, unfortunately, no clapping. You could do jazz hands.
Sorry.
I know, yeah, and have you seen an increase in overdoses in your line of work? Or I know you're probably more confined within Metro Hall, but when you go out into the community, do you see overdoses? Okay.
I have seen in my work, it's when I do have my cases as an investigator, I do the investigations to clients that are on their house, and when it's the time to contact them, it's really difficult to get them because they do have drug use issues, and they are very mobile. They are from one hospital to another and another and another. When then we lost track of them. Later on, we know that they were founded. I don't have the numbers at this point, but we know these facts because we track them. We try to track them for infectious diseases and stop the spreads of them.
Thank you so much. Councillor Bravo has a question for you. Go ahead.
Yes.
Yeah, thank you. I wanted to ask about just the general lack of investment and valuing of care work in Ontario. I noticed that, and it's one of the organizations that's funded. It's in the civil society side, but there is a coordinated strike that OPSU, Ontario Public Service Employees Union, is doing to ask for the provincial government to invest more in care work. Is this something that you think is important as well for the valuing of the kind of work that you do and the allocation that the provincial government could make to municipalities to be able to provide these services better, and obviously allowing us to continue to provide life-saving supervised consumption would have been an element of this. But I just wanted to get your take on the responsibility, the role, and what we could be demanding of the provincial government. Thanks.
Of course, it's always very, very helpful. So my take is that, as I recall, in the past meeting, it was told that labor relations said that representatives clarified that the Board of Health can request budget increase and bring the PHNs and wages in line with other municipalities. So I believe that any help is very welcome, helpful. So I totally think that will be very helpful. Yeah.
Thank you so much.
Thank you.
Thank you for your patience in answering your questions. Next up is Skylar Hill-Jackson.
May I have the overhead, please?
If you just place it on, it should come up.
Don't see it on the screen.
It's coming up. Have a seat. 3 minutes.
Toronto Public Health recommends 75 doses of 18 vaccines from newborn to age 18, and so far these multiple vaccines are not making our Toronto children healthier. Who is going to address this health crisis as our Toronto children suffer from a variety of lifelong chronic illnesses, and 1 in 36 children are on the autism spectrum? Our children are being treated like vaccine pincushions, and year after year, vaccines are being added to the childhood vaccine schedule, and no one is questioning the cumulative effect of these multiple jabs. Remember, Toronto Public Health also recommends 4 vaccines for pregnant women. Remember, everything crosses the placenta and the blood-brain barrier and may go into the unborn baby, like alcohol and smoking. The vaccine industry has done a remarkable job in capturing otherwise compassionate and intelligent people. The vaccine narrative that all vaccines are safe, effective, and necessary, and the general unshakable faith in this medical procedure is not based on scientific evidence or the result of extensive vaccine research. It is based on wishful thinking. No one in public health or legacy media is questioning this absurd number of vaccines, nor are public health institutions questioning the lack of safety studies or why there is such a relentless negative impact on the general health of our children. The pro-vaccine population supports informed consent, except when it comes to vaccine. Transparency, except when it comes to vaccines. Tolerance, except when it comes to vaccines. Parental responsibility, except when it comes to vaccines. Freedom of the press, except when it comes to vaccines. Open and honest debate, except when it comes to vaccines. Scientific evidence, except when it comes to vaccines. true placebos in safety testing, except when it comes to vaccines. The precautionary principle, except when it comes to vaccines. The pro-vaccine population believes in individual rights, except when it comes to vaccines, in parental rights, except when it comes to vaccines, my body, my choice, except when it comes to vaccines. Where there is risk, there must be choice, except when it comes to vaccines. All lives matter, except for the ones harmed by vaccines. If you don't think for yourself, someone will do it for you.
Thank you.
Do not believe everything you think.
Thank you. Any questions for the deputant? Seeing none. Thank you. Mariko Uday? 3 minutes.
Good morning, Board of Health. In the strategic plan, it says priority 1, objective 1A is to prepare for and respond to outbreaks and public health emergencies informed by best evidence and lessons learned from previous responses. So for me, I believe the COVID pandemic was a big outbreak, and there's many lessons to be learned from the pandemic. And one obvious lesson to me is that the COVID vaccines were not perfectly safe and not that effective, and that many people suffered and continue to suffer as a result of them. And in the next 3 minutes, I just want to go over my 3 sets of reasons for feeling that this is a valid area of investigation and end off with the solution. So first, reason is that they weren't thoroughly tested. There was rushed preclinical tests, and then the clinical trials were biased in that one thing I didn't realize before this was that it's not the government, Health Canada, that checks new drugs or vaccines. It's the companies that do that, and then they present reports to the government to look at. And as well, the second reason is vaccine injuries. I've heard testimonies of many people who have had vaccine injuries, and you can go to the website react19.org to read them yourselves. And also just observing people, some people I know, perfectly healthy and being affected. So that was my second set of reasons, and that's, I guess, personal. And the third now is the science. The science is, there's more and more papers coming out confirming things about the vaccine, such as DNA contamination and batch inconsistencies. When you have a vaccine or drug, every dose should be equal, but there was a lot of inconsistency in the batches, which should have pulled them off the market, but it didn't. And also they're finding that spike protein is persisting in the body. We were told that they would kind of disappear after a few days or weeks, but they have been found 2 years in the body, at least. And then a paper has come out by well-established cancer researchers in the US who have said that there is evidence for a biological plausible connection to cancer. This came out in 2026, I think. And they say it's very imperative that we investigate this further.
Thank you so much. Thank you.
And my solution, I ran out.
Sorry. Any questions for the deputant? Councillor Thompson?
What's your solution? What's your solution? You wanted to offer that, right?
So I would like to have
Put your mic on, please.
microphone needs to be on.
I turned it
Press
off.
the green button.
Yeah.
Okay. I would like there to be more openness about talking about these issues, investigating. I don't know, maybe there's some things I might be wrong about, but we need to talk about it, and we need to bring in people, scientists that know about it. There's a whole bunch of Canadian scientists that have banded under call2halt19.ca. Call, number 2, halt COVID-19.ca, and they've written a letter to the government, and they've outlined these issues like DNA contamination, batch inconsistencies, and the cancer and the persistence in the body and the LNPs. And this group's about to do a second letter because we weren't heard last year, and I'm part of this group as well.
Great. Thank you.
Yeah.
Thank you, Mr. Chair.
Thank you. And last on the list here is Mary Sharp. Mary Sharp. Three minutes.
Good morning.
Good morning.
I've had the privilege of working for over 5 decades as a healthcare practitioner and academic with pregnant and lactating women. Today, I wish to speak to your priority 2, promoting health throughout the lifespan. I have great respect for the complex physiologic processes of pregnancy, birth, lactation, and early infancy. I congratulate you on your support for breastfeeding and lactation consultants to optimize the health of babies and mothers. One simply cannot duplicate the precious substance of mother's milk. It took decades to push back against the corporations like Nestle's, who distributed formula and had contracts with government hospitals and healthcare workers to push their products and undermine breastfeeding locally and globally, often to the most vulnerable. Healthcare workers and government officials were passive for decades with respect to an epidemic of the rapidly diminishing practice of breastfeeding. In the 1950s, in Canada, breastfeeding rates had dropped to 20% and did not begin to recover until the 1980s. That is, it took 30 years. So I thank you for your support of breastfeeding. Over the years, I have witnessed technologies and policies that interfere with birth and breastfeeding, as well as the well-intentioned yet disastrous recommendations for certain medications during pregnancy, such as thalidomide to alleviate nausea, which cause severe birth defects of shortened limbs, and diethylstilbestrol, or DES, prescribed from 1940 to 1971 to help prevent preterm labor with its long-term intergenerational consequences that did not become apparent until they appeared in the next generation, causing cancer and reproductive abnormalities in female offspring. Not only were these medications allowed to be prescribed without proper safety studies, but when the adverse events were known, it took a long time to reverse practice. Since 1976, I have been aware of the dangers of vaccines that in some children have resulted in seizures, disability, and death. I have watched the movement toward the increasing number of childhood vaccines, and most concerning is the more recent normalizing of vaccines offered during pregnancy. Prior to 1997, vaccines and other drugs were discouraged during pregnancy. It was considered a sacred time, and the precautionary principle of above all, do no harm was attended to. Pregnant and breastfeeding people were excluded from initial clinical trials, and there have been no placebo-controlled studies, thus providing no evidence base for short or long-term safety prior to approval for use of any vaccine during pregnancy.
Thank you so much.
In spite of this anyway, I want to just say that,
Yeah, sorry. I'll allow you to resume your final comment. Just turn your mic back on. Just swipe and we'll turn green. I'll allow you to finish your comment. Go ahead.
Like formula feeding for infants and DES and thalidomide, how long will we need to wait until there is a robust appreciation of the serious dangers of vaccines, particularly during pregnancy, that will alter government policies and recommendations? In the years to come, will we all be looking back at the administration of vaccines during pregnancy with serious regrets, even remorse?
Okay, thank you.
Thank you.
Any further questions for the applicant? Seeing none. Thank you. Okay. I will just inform that there's one more speaker. Tom Schoenborn.
Could I get the overhead? The overhead?
Yes, just put your item on the overhead and it will come up. Okay, 3 minutes.
Okay, hi. Is that up correctly, Faisal? Yeah. Okay, hi. I'll try to keep this as brief as I can. I've come in to talk about 6 months ago about the prevalence of tuberculosis in the community and the concerns I have as a frontline worker, as a social worker at the time, doing a study in derangement at the front line in the community. I've been finding disturbing results. The concern that I am discovering severe disturbance in the public. This speaks to disease. This is about speaking to disease control and the paradoxical cognitive dissonance about the prevalence of recreational drug use in the community. I spoke to Michael Finkelstein, graciously agreed to speak to me about 6 months ago, but I haven't really gotten anywhere, and that's the concern. The concern is that responses I have received pursuing treatment of TB have become ultra-violent from everyone around me. I attempted to pursue higher access to the community to get this data in and to show that it was a severe and immediate emergent problem with the cognitive functions and faculties of the community, and what happened was not that I got a response, but instead that I got extreme violence from not only doctors and police, but also my family and friends. My ex-wife, everyone I know started trying to do Munchausen's violence to me, Munchausen's by proxy to me. The concern is they keep pushing me to try to pursue something else when this has been my entire life. And the harder I push this up the system, the more the system tries to hurt me and to take away my professional status and to incarcerate me in various ways for doing nothing wrong and doing due diligence to my profession. I found effective treatment. I was sick with tuberculosis for what looks like about 15 years, but the circumstance erupted at about 2020 that I had it became pretty evident, and it was at that point the violence started happening to me. I went to clinic after clinic after clinic, and they refused to treat me unless I produced a test. And I eventually found in the data, though, that I found a treatment that was widely available over the counter for tuberculosis at a 95% prevalence rate, but that this was never recommended to me by anyone. And it was a simple naturopathic solution, and it did treat me after I suffered for 2 to 3 years with extreme symptoms and many years with no identification of the disease. The concern is that the deeper investigation of TB is leading to Munchausen's by proxy and FDIA violence, and that this is some sort of mind weapon attack. That's what tuberculosis actually comes to represent for people who experience this. So the concern is that this is tying into deeper investigations into the MK Ultra, the history of MK Ultra from 1977, when it ended in 1977, and that this has become an issue in American politics at the present time. There's been a massive expose in MK Ultra. They're looking for more about this because most of the data pertaining to MK Ultra disappeared, and that they don't have a lot of the information. They have a big chunk, but not all of it. A significant amount disappeared.
You are at time.
I really need to finish this. Is that okay?
Unfortunately, I'm trying to be fair to everyone, so 3 minutes. Any questions for the deputant? Do you have a written statement on this? We could actually add it to the file.
Yes, I have a significant volumetric. This diagram that I'm trying to show you is how. You can add it all in. Okay.
Okay. Thank you very much.
Okay, I don't have it immediately here. That's the problem. I'll hand it in to you, but then the problem will come to, I won't ever hear anything back and I won't ever get help. And so I was here to request asylum from MK Ultra.
Okay, thank you. Thank you very much. It's okay, that was the last speaker. We're going to take it to committee now. Any questions of staff on this item? Go ahead, Director
Yeah, just on the item about the nursing compensation, we're good. I just wanted to double check if I had previously submitted a motion on that back in September regarding a comparison with jurisdictions. I think that is going to be presented in the fall. Is that correct?
I'll have staff response.
Was that the last meeting? Yeah. Oh, okay.
She wants to know when it will be brought back
Okay.
for presentation.
Last part, I mean, we did do the presentation on the nursing. That did continue confidential attachment as well.
Okay, I just wanted to ask that just because I think there were a lot of deputants who are wondering about the nursing compensation. And so just wanted to make sure that they had all of the information that they needed.
Okay.
Thank you.
Yeah, thank you. I'll probably just ask one or two questions. So in regards to action number 5, one of the things that we have seen surprising just come to this impacting not only Toronto but the rest of Ontario is the tick population. Is there anything that public health is doing to maybe address that? And also to another item that's really front and center. We see it in Europe now, and even last week, and I think this week is going to be really, really hot in regards to the extreme heat events. And again, that's this all climate change related. What steps is Toronto Public Health taking to address some of these things?
So to the chair, we have been tracking Lyme disease for a number of years as a disease of public health significance. So we've been previously involved in things like tick dragging to understand where ticks were in the population when it was first emerging. We do know now ticks are endemic to basically all parts of Toronto. So everywhere in Toronto, there is a risk of acquisition of ticks. This particular year is a very high year for ticks. So we have increased our communications and reminders to the public around things that they can do to prevent getting ticks. So, being exposed to that is things you can do to wear, how you can wear light color clothing, long sleeves, long shirts, the use of DEET products to prevent acquisition of ticks, and then coming home, making sure that you're doing a tick check to remove the ticks within 24 hours, because that's what prevents the transmission of Lyme disease and other diseases that we now see that have been added. So we have now anaplasmosis, babesiosis, and Powassan disease are also tick-borne diseases of public health significance that we're tracking within the city as well. So certainly all of these measures that we're reminding people of, the things that they can be doing for themselves, for their pets as well, when they're out, is to making sure that they're not bringing home ticks. So I think there's a lot that we are continuing to do there. On the heat, we are part of the heat mitigation strategy for the city. So the city has a number of activities that are in place all summer long, and then additional enhancement of activities that happen during heat alerts like we are in right now. And Toronto Public Health particularly contributes to the cool spaces where we monitor and track the over 500 locations across the city that people can access as an air-conditioned cool space that they can go to for relief and maintain that web page and map where people can then find locations where they can get that relief.
Wonderful, thank you. And for Action 13, so we have a lot of public health nurses here today. It talks about frontline, it talks about training for frontline staff around trauma-informed approaches. What are the timelines to actually training our staff around that?
So the trauma-informed training was the one item that was, incomplete on our list, and so that has now started. People can sign up already now, so people got information in the last few weeks as to the sessions that are available over the summer and into the fall to be able to sign up for the trauma-informed training. Practice that it's available. I myself am doing it tomorrow afternoon, so looking forward to that training as well as that rolling out across the staff. To be able to complete that item and making sure that we'll track and see uptake and re-encourage staff who might have taken advantage of later in the fall.
Okay, great, thank you. Those are my questions. Any other questions? Councillor Thompson, go ahead. Question. Oh, sorry. Yeah, go ahead, Councillor Thompson.
Thank you. Through you, Mr. Chair, to the Medical Officer of Health. In Action 6, you talk a little bit about the playground activity leaders and so on. Can you help us to understand how do you work with the schools and the boards and so on in order to engage this process?
Thank you very much for the question, through you, Mr. Chair. We work with the boards, we meet with the boards quarterly to identify different priorities for each of the schools, for each of the different 4 school boards. And within that, we also identify priority schools, those schools that have a higher need. We have school liaison public health nurses that are assigned to those schools, and those school liaison nurses work with the school administration to initiate different programs that meet the needs, particularly for the PALS program. We currently are offering that program for students in grade 4 to 6. So the school liaison public health nurses would do training with those leaders within the school, kind of through a train the trainer model, and then those students develop leadership skills and then implement playground activities in the schoolyard to promote physical activity, but also positive mental health and inclusion.
Fantastic. Thank you so much. Through you, Mr. Chair, I think this is for the medical officer of health. And in the vision, you talk about a city where all people can be healthy and thrive. Can you help us to understand what is the criteria or what's the definition of a healthy city? What are some of the characteristics and so on? And what are some of the initiatives that we're actually doing to engage to ensure that those characteristics are borne out, to ensure that we actually have a healthy population, a healthy city?
To the chair, I think one of our first fundamental activities as public health is always surveillance. And so we do have a population health status indicator dashboard. That's our collection of health status indicators for the city. We do try to have those at city level and, if possible, down to a neighborhood level where we can, to be able to look at those indicators of wellness and well-being across a number of factors. So everything from births to deaths in terms of how people are doing. I think that there's also parts of that we then translate into how are we moving forward to it, and those strategic areas we're trying to focus in on, which I think really speak to the first 3 areas of the strategic plan. So recognizing, the first one, health protection, disease prevention, emergency preparedness. We've seen how each of these things in terms of infectious diseases and emergencies can impact health, and so the activities around there. The second one being around chronic disease prevention. We do know that there's new modeling out from the Ontario Health Association as well as the University of Toronto to show as our population ages, the impact that's going to have on chronic diseases and increases in chronic diseases. So most of our efforts are also in that space of how do we get people to stay healthier for longer. And then the third area, certainly in terms of mental health and substance use as being a key or focus of area where we've had initiatives like Our Health, Our City to be able to guide the actions that we're doing to try to measure and to put in measures to keep the city safer and healthier.
Thank you. Thank you, Mr. Chair.
I think Director Ozode, I think I saw your hands up.
Yes. Can you all hear me clear?
Yes, we can. Go ahead.
Yes. Well, first of all, I want to thank all the staff for the updates and for the report. I remember when this was being developed, so it's good to see that we have a lot of action going forward. I believe 21 over 22 actions are active or completed. So I've got 2 questions. The first one is, as this reporting matures, right, how can the board see a clearer distinction between activities and outputs? So how can we differentiate between the reports, training, and participation versus actual population health outcomes?
To the chair, I think that's $1 million question in terms of some of the things that are as long process-wise in public health. So I think there's a number of things that we are able to show very quickly. Things like last year when we had over 2,000 cases of measles within the province, and that we only had 10 in Toronto, that we can show very immediate action that the steps we're taking against the strategic plan and disease prevention are working well in terms of achieving that continued health in the population population. There are other ones, like we mentioned, the chronic disease or mental health, where it's going to be an incremental. We're not going to see change within a year. We're not going to see change even necessarily in 5 years. We're going to need to see more process-based indicators to say, are we moving in the right direction? Because we might not see those health outcomes as immediately. So I think there's a mix of things that we can be showing and demonstrating where we're making progress, where we're strengthening partnerships, where we're working better with others and engaging the community to show that we're working in the right direction, even if we're not going to necessarily see that change in health outcome immediately.
Okay, thank you. Yeah, I guess maybe I was being a little ambitious because I know this is the second year of the report of the strategy, and I noticed there was a lot of reporting on reports, training, and participation, and I was hoping to see a bit more concrete impact. So for my second question, I think it says that 19 actions are currently on track, which is a positive development. I'm curious, though, which of these actions face the greatest implementation risks or threats between now and the end of the strat in 2028?
To the chair, I think we already had a motion back in 2024 where we were directed to do a more fulsome report in Q3 of 2027 as we're now kind of then entering the third year of the report and getting ready for renewal in 2028. So I think we'd be looking to bring back next year, once we've had a longer time from 2024 to 2027 to really do that assessment to say where are we, what are things at risk, what are things that we really maybe need to refocus on, and what's the engagement plan going to be for starting that work in 2028 to have a new strategic plan for 2029 and beyond.
Okay. All right. Thank you. Those are my questions.
Thank you. Any other? Okay, Councillor Cheng, go ahead.
Thank you, Chair, to the Medical Health Officer. I think that it's a very difficult job that you have, and there are so many issues. I don't even know how we pick our priorities. But I am concerned about a few things that have come to the surface. One is there's been an increase in psychosis in young people related to cannabis use. Secondly, kidney disease is the fastest growing chronic disease in Toronto. And thirdly, something that I have long been concerned about is the impact of loneliness on public health, that we know that it impacts chronic illness. It also impacts mental health and addiction. We are the loneliest city in Canada, according to recent research. And I'm just wondering, these three, I think, emerging and important factors in public health, how are they considered in our strategic planning?
So to the chair, we have all of those three currently within our existing strategic plan. The first and the third are captured within the third strategic priority area of mental health and substance use. So Our Health, Our City does recognize the harms of substances like cannabis and the impacts that it can have, including that increased risk of psychosis on first initiation of use, as well as the loneliness component. So we are partnered with Thrive Toronto, which is a coalition of mental health agencies and providers across Toronto who have shown as part of the report card in January of this year that social isolation certainly does contribute to mental health in the city, and that we are looking at actions to take forward on that space. And then the kidney disease, that is correct. While low, it is currently about 3% of chronic disease within Toronto. It is projected to increase to 9% by 2040. So it is a rapidly growing one. But the largest driver of kidney disease is high blood pressure and diabetes. And that chronic disease prevention is certainly at the pillar of the work that we're trying to do within the Strat Plan Area 2 of looking at chronic disease prevention. How do we get people to become more physically active? How do we encourage healthier eating? How do we encourage that early connection to care so that people can get screened and tested and treated for things like high blood pressure and diabetes by being connected to primary care?
We thank you for that information. It is helpful to know it's folded in our strategic plan. I think one thing that is evident in our city is we're increasingly a vertical city. And has there been any research connected between loneliness and the verticality of our city? And should there be some analysis of how we design public spaces or how we, I think, fund public initiatives that foster more social connection in an increasingly vertical city?
I'll start and then I'll turn it to our Chief Nursing Officer. So one of the initiatives that Toronto Public Health is part of is 880 Cities. So that is an organization that looks at designing and creating cities that are designed from everyone from age 8 to the age 80, that we are thinking across the lifespan about how to promote more livable and connected communities in that space. So it's through that partnership and work that we've really been thinking about more of that built environment component. But I'll turn to Joanne, if there's more to add.
Yes, thank you. This is an area that we're actively exploring and continuing to build partnerships to look at different ways, both with internal city partners, but also with partners externally, like Dr. Murdy mentioned, in terms of 880 Cities. We're also doing different research initiatives. So as part of the Embolden project, we've taken that into consideration in terms of how do we get increased physical activity and social connection with older adults. And so this work is emerging, and we're looking forward to incorporating some of that into some of our initiatives over the next year.
Great, thank you. Those are my questions.
Thank you. Any further questions from members? Go ahead, Director Ador.
Thank you so much, Mr. Chair. I thank you so much for this report. It's amazing to see all the incredible work that Toronto Public Health is doing. I have a question specifically about the piece around collecting sociodemographic data. Couple questions. My first question is about the report mentioned training staff up on OCAP principles and EGAP. Within the context of First Nations, Inuit, and Métis data sovereignty, there's other frameworks as well. I think of the ITK framework, there's the International Care Guidelines, and I was wondering to what extent Toronto Public Health is or will be supporting staff around like a broader understanding of different frameworks that might be nation-specific.
To the chair, I'll start and then also turn to our Deputy Medical Officer of Health. I think is. Oh, there, yeah. To Alison? Okay, great. Just to say, yes, I think that beyond OCAP for sure, in terms of other nation identities and the other principles that we have around sociodemographic status, and certainly taking the way we might be collecting and working with Indigenous communities as part of that. I'll say one of the next rounds of training some of the staff are moving forward on who are involved with this work is with there's a Black community training in terms of cultural sensitivity and appropriateness of how we are collecting race-based data in that space. So I think that this is an evolving process in terms of how we're being inclusive of all of the ways that we're collecting and working with communities in that data. But I'll turn to Dr. Chris if she wants to add anything else.
Thanks, and through the chair, I would reiterate that there's opportunity here for the consultative process to further strengthen the program.
It actually speaks to my second question. You touched on it a little bit, was actually around how, like, training staff on how to ask that question in a good way, particularly because it can create concern for Black, First Nations, and Métis folks. I was also thinking in relation to the breastfeeding clinic too, and where our children are involved. I was wondering if you could speak a little bit about just some of the work you might be doing in ensuring that folks, if we're asking that question, that staff are trained in how to ask it properly, and creating that safety for folks when they're being asked to feel comfortable to provide an answer.
Thank you for the question through the chair. We had invested a substantial amount of time in developing a training plan for our frontline staff who will be asking the questions. That training was implemented in a small pilot study where we collected feedback to see, to kind of learn from that experience, and then we continue to expand and roll it out, strengthening our training plan as we go along. It is an important piece of work that we're very aware of and conscious of the planning.
Thank you very much. Councillor Bravo.
Thank you. Through you, Chair, I have two questions for the Medical Officer of Health. The first one has to do with deputants talking about the need to do more in relation to safe use, safe consumption, and to ask, why we need to continue to advocate and if you could answer that. And the second one has to do with for your role as a manager, how the public health nurse, what are the management, what's the approach to ensuring that some of the issues raised, not just compensation, but other issues raised around pressure and burnout are being faced? I realize we're not in a compensation is something that does happen in bargaining, but it's nevertheless, as for public health as a manager. Thank you.
So to the chair, I think this board has made a number of motions, calling on to look at the drug crisis and the impact that it's had because of the closures of supervised consumption sites. As far back as the injunction in terms of the legislation that led to some of those changes. So I think, we're certainly still seeing, the shift in the landscape in terms of where people can go to get care and where they might feel comfortable seeking that kind of support because these spaces are not as available anymore. And we see it, I think, in terms of our own staff, our harm reduction outreach staff, as well as our core team nurses, and through our Heart Hub staff in terms of people trying to connect, through outreach to find people when we don't have those central places anymore and it becomes much more difficult, or connecting them through the drop-in centers that exist or through shelters where they might be going as other places. But it's a loss in terms of the number of places that we've had when we had 10 at the beginning of 2025 and now there's only 3. So certainly I think we see that, and we've spoken to that almost monthly at this board in terms of the impact that's had. In terms of your second question, for public health nursing, we did, I think, show at the last meeting in terms of the nursing report, the efforts to address the recruitment component, because certainly understaffing was an issue in terms of having a number of vacant positions. We have been able to move forward on over 100 positions for nurses, some 69 permanent of those last year in 2025. And we've also moved forward on a significant number in 2026 and have also, I think, almost 50 in the works in terms of additional nursing positions that we're trying to address. And I think certainly some of the workload and burnout and the wait list that we were seeing in program areas was because of that decrease in staffing that we're trying to address.
So I'll sneak one in. Sorry. So yes or no, are we on track to meeting the hiring objective, the target?
I think it'll be a rolling target that we have. I mean, we certainly do have a number of retirements in the next 5 years as across the board, across the healthcare system. There are a number of people who might be eligible for retirement in the next 5 years. So this is going to be an ongoing process that we're going to continue to monitor very closely. But that active hiring is something we are doing continuously.
Thank you. Seeing no other questions of the members, I will then go to speakers. Any speakers on the item? No?
Chair, I believe I have a motion or 2 motions that have been prepared by staff.
Okay. Now, this is the last meeting, but I've always asked that motions should come through the chair first so I could review it, but I haven't seen the motion. Can we hold it down so the other members can actually take a look at it? Because, yeah, let's hold the item down so that everybody has an opportunity to look at it. Okay?
Sure.
Okay, thank you. The next item is, where am I? Number 2, yes. Yeah. HL 34.2, 2026 Board of Health Procedures Bylaw Review. There was one speaker on the item who actually withdrew. So any questions on this item from members? No? Any speakers? Seeing none, so I'll ask Councillor Bravo to move it. All those in favor? Opposed? Carried. We're now going to item number 3, which is responding to the Constance Lake First Nations Coroner's inquest into Blastomycosis outbreak deaths. Director Madore had a question of staff. Go ahead.
I did have a question. Thank you so much, Mr. Chair. I have actually 2 questions. My first question was around the communications plan. The report noted, which I think is absolutely true, that lots of folks, I'm not only around like evacuations, which I was happy to see that Toronto Public Health supports, but also there's a lot of people, as we know, coming into the city from Northern Ontario, from other places. And I was wondering if you could speak to the communication plan and whether or not there's intention to reach out to Indigenous-led organizations, service delivery organizations, emergency departments. Like, I was just hoping to understand a little bit more about what the plan was there to really ensure that folks who may be showing up in EDs or other places, that there's awareness of this disease.
Thank you for the question to the chair. As you indicated, we are really focused on trying to get information on blastomycosis out to healthcare providers. They're the people who are likely to see individuals from our community with this uncommon illness. So we are developing additional information for healthcare providers to raise awareness of this disease as the coroners had requested.
And I'm wondering if you could also speak to a little bit, the report noted that TPH is working with chiefs and councils and a variety of partners to support planning when First Nations are evacuated into the city. And I was wondering if you could tell me a little bit more about what that looks like. I'm curious to hear how decision-making happens, how that partnership sort of happens.
To the chair, so it is a provincially coordinated evacuation response. So it is through Emergency Management Ontario. Once a First Nation has decided that they need to evacuate or would like to evacuate. So that is organized provincially, and then they try to find where is the best site to be able to host that community depending on their needs. So many of the communities who unfortunately do have a ongoing history of needing to evacuate have medical plans, who is in their community, how are they, what kinds of places they need to come to. And so that gets looked at across the province to say what might be suitable host sites and where is available. So, I think we were certainly surprised that because we were in the midst of FIFA, that we were still a site because many of the hotels were already booked up. But we were able to accommodate communities that didn't need to evacuate and be in the GTA region. Then they work very closely with places like Indigenous Services Canada, and then through us with local Indigenous healthcare providers to be able to make sure that we have resources on site to provide supports and care depending on how long they're staying here. And then we, through our Indigenous health team at Toronto Public Health, help to coordinate any services and supports they might need. Often it is things like our vaccine program, if they might need any catch-up or support, as well as our dental provisions in terms of providing dental care and access to communities while they're here. And unfortunately, one of the largest areas of support is in harm reduction and being able to provide naloxone and harm reduction supplies to the communities when they're here.
Thank you.
Absolutely. Seeing no other questions, speakers on the item. Oh, you have a question? Go ahead, Director Zhao.
I just had a more practical question around the blastomycosis. For healthcare providers, if we suspect someone has pneumonia-like symptoms, how would we test them? Will we be getting a sputum or just doing a chest x-ray? How would we know to diagnose them with that?
To the chair, you're right. There are many different causes of pneumonia in our environment, and that's one of the things that we're going to try to communicate to public health, to clinicians to put this on their diagnosis. If they've gone through a number of the more common reasons for pneumonia and they still haven't got a diagnosis, to consider this, particularly if this person has come from a place where this fungus is more common, because in this area it's not that common, but people move around the province, and so you're right, if clinicians have gone through the more common cases, this has to be on the differential diagnosis, and that there are tests for it, and so that's going to be part of our communications.
Got it. So you would also list like what types of tests we should be ordering.
Yes, that's yeah. We'll make reference to the tests that the public health labs have for.
Got it. Thanks.
Okay, thank you. Seeing no other questions, speakers on the item. Seeing none, I will have Director Medor move that item. All those in favor, opposed, carried. The next item is HL 34.4, Public Health Role in Indoor Air Quality. I think we have a presentation on this item. Okay.
Test. Can you hear me? Okay. Okay, let's wait for the presentation to come up. Yeah, it's on. It's on.
Okay.
Yeah, sorry. Oh, no, I'm not going to be sharing my slides.
Oh.
Kelly, are you able to share the slides? Okay, there we go. All right, good morning, Chair and board members. My name is Dr. Shovita Padi, and I'm one of the Associate Medical Officers of Health here at TPH. Today, we are presenting Toronto Public Health's report on indoor air quality, otherwise known as IAQ. Indoor air quality has become an increasingly important public health issue due to growing awareness of respiratory health, climate-related air quality impacts such as wildfire smoke, and the role of indoor environments in infectious disease transmission. This report reviews the evidence, summarizes stakeholder input, clarifies Toronto Public Health's role and authority, and identifies opportunities to strengthen public health action and communication on indoor air quality. Next slide, please. Indoor air quality is influenced by a combination of factors, including pollutants generated indoors, contaminants entering from the outdoors, and the effectiveness of building structures. Common contaminants include particulate matter, carbon dioxide, volatile organic compounds, otherwise known as VOCs, allergens, mold spores, and gases such as ozone and nitrogen dioxide. Poor indoor air quality can contribute to a range of health impacts, particularly affecting the respiratory and cardiac systems. Next slide, please. Health Canada identifies 3 key strategies for improving indoor air quality: source control, ventilation, and filtration. There is no single solution for indoor air quality. The best protection comes from combining all 3 strategies while recognizing that additional public health supports may be needed for residents who face barriers to implementing these measures. Firstly, and the most effective strategy is to reduce or eliminate contaminants at their source. The report notes ventilation and filtration cannot fully compensate for major indoor pollution sources, so source control should come first whenever possible. The second strategy is ventilation, bringing in cleaner outdoor air to dilute indoor contaminants. So when the outdoor air quality is good, ventilation can reduce concentrations of indoor air pollutants and respiratory particles. However, the report does highlight that ventilation is more complex during wildfire smoke season. During these periods, opening the windows can actually increase exposure to harmful outdoor pollutants. So this really reinforces the importance of providing residents with clear guidance on when ventilation is beneficial and when alternate strategies may be needed. Lastly, we have filtration as the third strategy. And this becomes particularly important when source control is not fully possible or when outdoor air quality is poor. Portable HEPA air cleaners and properly designed do-it-yourself box fan filters can reduce indoor fine particles, including particles from wildfire smoke. The report notes that filtration can be especially valuable for higher risk individuals during smoke events. The report does recognize that not everyone has the same ability to improve indoor air quality. Barriers include the cost of purchasing and operating air cleaners, replacement filter costs, housing conditions, and lack of control over building systems and renters and residents of shared housing. Next slide, please. One of the report's recommendations is to strengthen public communication on practical actions that people can take at home. While many aspects of indoor air quality are controlled by building owners, landlords, employers, and other institutions, residents can still take important steps to reduce exposures in their own environments. So firstly, don't smoke or vape indoors. Activities also such as burning candles, incense, wood, or using gas appliances can also contribute to indoor air pollution. Maintain your fuel burning appliances. Properly functioning fuel burning appliances can help reduce indoor air contaminants and combustion byproducts. Control indoor moisture. So moisture intrusion can lead to mold growth. Preventing and remediating moisture problems is one of the most effective source control measures available. Choose low-emission products and safely store chemicals, including products, paints, and solvents, and other household products that can release contaminants into indoor air. And then avoid ozone-generating devices, as ozone is a known lung irritant. And so ozone can actually be produced by some air cleaners, ironically, so avoid ionizing air cleaners or devices that say they use ozone to clean the air. In terms of ventilation, as reiterated, you want to increase ventilation when the outdoor air quality is good. So this helps dilute the contaminants and bring the cleaner indoor air inside. Examples include opening windows when conditions permit and using kitchen exhaust systems vented outdoors while cooking. And as mentioned, this should be adapted during wildfire smoke events or other poor air quality conditions. Lastly, for filtration, use certified portable air cleaners and avoid air cleaners that produce ozone. Filtration can be particularly helpful when source control is not fully possible or when outdoor air quality is really poor. And the HEPA air cleaners especially can reduce indoor fine particulate matter, especially wildfire smoke particles. Next slide, please. Responsibility for indoor air quality is shared across multiple levels of government and sectors. There's no single authority that oversees all indoor air quality issues. In Canada, Health Canada provides the primary scientific guidance on indoor air quality through resources such as the Residential Indoor Air Quality Guidelines and technical guidance for indoor air quality professionals. These documents establish the evidence-based recommendations, but they are generally advisory rather than enforceable standards. Regulatory requirements are distributed across different legal frameworks. For example, building design, ventilation, and construction requirements are set by the National Building Code and the Ontario Building Code. Workplace indoor air quality falls under occupational health and safety legislation, and housing conditions may also be addressed through municipal property standards. Toronto Public Health's authority comes through the Health Protection and Promotion Act. Our role is to investigate potential health hazards, provide health guidance, and work with partners when concerns are identified. However, public health does not regulate building ventilation systems or indoor air quality standards for most buildings. Next slide, please. So TPH's indoor air quality role is actually multifaceted. While TPH does not regulate building ventilation systems or mandate infrastructure upgrades, public health contributes through evidence-informed guidance, investigations, outbreak response, advocacy, communication, and partnerships to help protect Torontonians from indoor air quality risks. And I'm just going to go into this in a bit more detail. So firstly, with evidence-informed guidance, TPH monitors and interprets the emerging evidence and guidance from the federal and provincial governments, and then translates technical guidance into practical public health advice for Toronto residents and partners. The report recommends strengthening public-facing information on practical evidence-informed actions people can take in their homes. Complaint investigation. Under the Health Protection and Promotion Act, TPH investigates complaints related to suspected indoor air quality health hazards. All indoor air quality complaints were followed up by public health staff through either the phone or site visits with clients. Generally, staff could provide education and guidance to clients related to TPH's role and jurisdiction, ways to improve indoor air quality, asbestos management information, and referrals to other agencies when appropriate, such as the Ministry of Education or the Ministry of Labor. So last year, in 2025, 100% of the 288 indoor air quality complaints received by TPH were investigated. 94% of these investigations were in residential settings, and 2% were in childcare or school settings. No legal enforcement actions were necessary that need to be taken by TPH under the Health Protection and Promotion Act. Next, we have outbreak investigations. During outbreaks in institutions such as long-term care facilities or congregate settings, TPH provides infection prevention control guidance aimed at reducing transmission in shared indoor spaces. We promote a layered approach, which includes, of course, vaccination, hand hygiene, staying home when sick, masking when appropriate, and improving ventilation and filtration. Next, we have advocacy. TPH uses evidence to advocate for policies and investments that improve indoor air quality and health equity. The report recommends provincial action to reduce wildfire smoke exposure, support indoor air quality improvements in schools and childcare settings, and improve access to filtration for vulnerable populations. Next, we have communication and education. TPH provides public education and risk communication on indoor air quality, respiratory virus prevention, and wildfire smoke. Public communication focuses on practical actions people can take to help residents understand when and how to use measures such as ventilation and portable air filtration. A key example is TPH's wildfire smoke response work, including guidance for residents and child care centers. TPH also supports a network of cleaner air spaces across the city, and this provides access to filtered indoor environments for residents who may not be able to maintain their cleaner air at home during wildfire smoke events. Lastly, we have partnerships, and TPH works collaboratively because we know most authority over indoor air quality sits outside of local public health. Partnerships include school boards, city divisions, provincial partners, academic institutions, and advocacy groups. Through these partnerships, TPH supports the knowledge exchange, consistent public health messaging, respiratory virus prevention efforts, and practical indoor air quality guidance. The report specifically commits to the ongoing collaboration with school boards and participation in academic and knowledge-sharing partnerships. Next slide, please. And I'll hand it to Dr. Murdy to speak a bit more about our collaboration.
Thank you. So Toronto Public Health undertook targeted engagement to inform this report, including multiple meetings with Clean Indoor Air Toronto and organizations including the Ontario Society of Professional Engineers, Canadian Environmental Law Association, and the Canadian Association of Physicians for the Environment. Toronto Public Health also engaged Toronto school boards to understand current practices and opportunities for Toronto Public Health and schools to continue to work together on environmental health and consistent public health messaging. We also participated in a workshop with the Hub for Advancing Buildings at the University of Toronto with experts in indoor air quality. Engagement with participants emphasized 4 main themes: stronger public communication on respiratory virus prevention and practical indoor air quality measures, concern about indoor air quality in schools and childcare settings, the need to address wildfire smoke, extreme heat, and other climate-related indoor risks, and fourth, the interest in monitoring public reporting and building level improvements linked to feasible mitigation actions. One of the report's key recommendations is improving public access to practical and evidence-based information on indoor air quality. We have already begun implementing this recommendation through the development of a dedicated indoor air quality webpage. The goal is to provide residents with a central source of reliable, trusted information about indoor air quality risks, actions they can take to protect themselves and their families, and guidance during events such as wildfire smoke episodes. This work will continue to evolve over time as new evidence emerges and we identify opportunities to further support residents through accessible public health communications. This report provides a practical roadmap for strengthening public health action improving communication with residents, and supporting healthier indoor environments across Toronto. Thank you.
Thank you, Dr. Patty and Dr. Murdy. We do have a number of speakers on this item. First up is Arnold Margolis. Margolis? Online? Okay. Yeah, 3 minutes. Go ahead, sir.
3 minutes. Yeah. Good morning. Thank you for giving me 3 minutes. I'm a little bit surprised by a very narrow view of Toronto Public Health on their role in enforcing indoor air quality. And as you know, I presented a number of times on these Board of Health meetings, reporting that some landlords, in particular in our building where I live, maliciously contaminate on purpose indoor air quality to speed up tenants' turnaround or retaliate for tenants' complaints. And whatever the presenter, Ms. Pathi, was calling the like responding to the residents' complaints and doing investigation, this is grossly insufficient practice based on a number of factors. In fact, what I proposed at the early meeting was to ensure proper training of the staff engaged in such investigations, to identify suppliers of proper handheld equipment that not only measures level of dust in the units, but also volatile organic compounds and some other chemical contaminants in the units. So far, they don't measure it and just basically mislead the residents, claiming that everything is cool in the units when they are responding to investigation. So their reports on a number of actions taken is totally false because they failed to engage, proper sections of the law they enforce. So they have to establish also cooperation with health environment units of the Public Health Ontario on borrowing the proper equipment. They need to establish also cooperation with provincial authorities, in particular Ministry of Environment and their lab, in measuring the level of contaminants with overnight measurements. And they need to establish night shifts to measure contamination at night when they receive complaints. And I propose the pilot enforcement.
Mr. Arnold? Can you hear me, sir? I'll pause this time. Mr. Margolis, can you hear us? We'll come back to him. He has a minute left on his clock here. Next up is Greg Evans. Are you here? Online? Mr. Evans? Mr. Evans, can you hear me? Oh, sorry. You know what? You're correct. I'm looking at the wrong list. Debbie King. Debbie King. Is she online? No? Okay, we'll come back to her. Candace McNaughton. It's just blacked out. Okay, well, let's try Louis Hittinger. Is Candace there? Let's go back to Candace McNaughton. Candace? Candace, can you hear us?
Yes, okay, good.
There we go. 3 minutes, go ahead.
Okay, lovely. And I don't think you guys can see me, or I prepared a couple of slides. Looks like we're having some technical difficulties. So I will just use my time to speak. First off, I just want to thank the Board of Health for involving us.
I was just advised that you're given presenter
Oh, I am? Okay,
yes.
Lovely.
Status.
All right, I'm going to start the video. Here we go. And I'm going to share. Here we go.
And then we can see you now.
Excellent. Okay, lovely. Lovely to see you all. Can you guys see my screen there?
Not yet.
Okay.
There we go. Okay, go ahead.
There we go. Okay. All right. Whoop. Okay. All right. So I'm here on behalf of Clean Indoor Air Toronto, and thank you so much for your time, and thank you all for engaging with us through this process with regard to the importance of clean indoor air as a component of public health. I want to sort of just highlight the fact that clean indoor air really is the foundation for all of the components of the public health strategic plan for 2024-2028, but it is directly a foundational component of the first, second, fourth, and fifth components of the strategic plan. And really, you need good, clean indoor air in order to have a good mental health. So I'm here as a member of the public, a member of Clean Indoor Air Toronto, but I'm also a parent of 2 children who attend TDSB. I'm an emergency physician, so I take care of many vulnerable patients in the emergency department across the age span from, babies, not that often, but more often at the, our patients who are, on older and who have cancer and who have immunocompromising conditions. And I'm also here as a patient myself, and a member of the public who has to go into public buildings. One of the things I want to highlight is, even though Toronto does a really good job and we have a very strong foundation in public health and we're one of the best places to live in North America, and I would argue the world, there are gaps in life expectancy across the city that can be traced in part to varying access to clean indoor air. So if you live in one part of the city versus another, your life expectancy can vary by up to 12 years, which was rather shocking. And this can be traced in part to this screen here. And Dr. Heidinger is going to speak in more detail about CO2 with her chemistry background. But what I want to highlight here is, so CO2 is something that we exhale. For like more than 100 years, people have known that CO2 is a really good way to measure how good the air quality is in a room because it's a fantastic proxy for ventilation. And what we find is that for members of the public, such as myself, other members of Clean Indoor Air Toronto, and our family members, if we go to places in the public, CO2 levels are often above 1,000, 2,000, 4,000. And you can't see or smell it. You don't really know unless you have a little monitor there. This is the optometrist, unsafe. So levels above 800 parts per million start to have negative health impacts. But there's an invisible layer of protection around certain areas and certain populations, such as individuals who get to work in government buildings or in private schools or in certain parts of hospitals or certain areas of healthcare, where you can see that, in the one hand, if you go out in the community and you see an optometrist and you're breathing really backwashed air from other people in the room with you. If you go into Queen's Park or City Hall or the North York Civic Center or other areas in Queen's Park, you're not inhaling backwashed air to nearly the same degree. And so there's a much greater level of safety. So that leads me into this. So thank you for the report. We are very grateful for the increased scrutiny and emphasis placed on indoor air, but there are 3 things that we would like to see added to the report as it exists, and we've sent along written comments. But to briefly state, we would like to see clear statement of indoor air quality guidance with clear thresholds so people can look at it, a recommendation to the province of Ontario to update the building code and enact a Clean Air Act, and to clearly define a plan for public health communications regarding indoor air quality and airborne hazards.
Sorry, you are time. My apologies.
Thank you. Yep, thank you.
I got so caught up into your presentation. Any questions for the deputy? Seeing none. Thank you so much. Louise Hittinger. We have Debbie now? Okay, Debbie King, are you there? We can't hear you. You're still on mute. Not. Try again. No, we can't. Yes, we can hear you now.
Okay.
Three
Sorry,
minutes.
just give me one moment to make a quick adjustment to my volume. All right. Good morning, board members. My name is Debbie King. I'm a resident of and TDSB trustee for Parkdale High Park. My deputation today is focused on the public health role in indoor air quality with respect to communications, guidance, and school communities. I want to start by acknowledging the work by Board of Health, Toronto Public Health, and Clean Indoor Air Toronto, whose advocacy has helped lead to the report before you for action today. I attended the Clean Indoor Air Toronto community event that was held on Saturday, where I saw firsthand how communications supports informed decision-making. So during that workshop presentation, we heard some of the same information that you've shared today, but including how to improve indoor air quality at home. But notably, we also learned about measurements that represent acceptable indoor air quality in other spaces and overall. So some of the examples that were provided were ranges that are found in indoor public spaces such as public transit and public schools. It was interesting to me that a mentee who was with me, a young person, heard those numbers, leaned over to me and said, "Oh, I'm definitely wearing a mask on my subway ride home." And she did. She picked up an N95 mask that was available that day and wore it for her commute on public transit home, which is over an hour in duration. So what that told me is that the data is very compelling. It's very impactful evidence. And I'm thinking about how that decision made by one individual could multiply across our school communities, where we have close to 250,000 students and 40,000 workers in TDSB buildings alone. We also have children and workers in daycare spaces, as you know, and a number of community members in classrooms, gyms, pools, after hours. So school buildings are very much hubs for community, where there is an extraordinary number of residents who interact and could benefit from more concrete understanding of the IAQ in these spaces and the mechanisms for measurement. And I think this is where Toronto Public Health has an opportunity to expand on the suggestions that have been provided by Clean Indoor Air Toronto and in its recommendations. So just two that I think can benefit from more specificity are continued collaboration with school boards and parent caregiver communities. That includes guidance around those ranges for indoor air quality parameters that would define what good or what acceptable measures are, and that would help leadership and help communities to identify and to respond where the risks have been heightened. And then secondly, the recommendations to the province of Ontario.
Final thoughts, Debbie, sorry. Final thoughts.
Yeah, thank you. Just to have some province-wide requirement for CO2 monitoring in our schools. And I think both of those would help strengthen your strategies around health promotion and health equity.
Thank you so much. Any questions for the deputant? Seeing none. Thank you, Debbie. Arnold, can you hear me? Arnold Margulis? Okay, let's go to Louise Hittinger. Louise, can you hear me?
Hello.
Sorry, I see Arnold now. Okay, you have, before you were disconnected, you had 1 minute left on the clock, so I'm going to allow you one minute, so go ahead.
I apologize for my computer being frozen. And the thing is that I also suggest the public health on this issue to communicate with and cooperate with other city enforcement departments. And Ms. Pathi apparently is also associated with clinical division of the U of T School of Public Health, I suggest you also to contact Occupational and Environmental Health Division of the same schools, and in particular indicated in my email contact person, because they have wealth of experience in measuring indoor air quality, and they will definitely help your department to enforce indoor air quality. Just establish contact as you claim you are doing with university institutions, and that would definitely help it. But in general, this topic requires a serious rework in order to, and I suggest the pilot on enforcing indoor air quality using suggestions from my email sent on the previous presentation.
Yeah, thank you. Thank you so much. Appreciate your comments today. Any questions for the deputant? Seeing none. Thank you. Next up is Louise Hittinger. Are you here, Louise?
Hi there. Just one moment while I get my presentation up.
Okay, you have 3 minutes.
Okay, could I get permission to share? Thank you.
Yes, presenter status has been given.
Okay, can you see my screen?
Yes, we can. 3 minutes. Go ahead.
Okay, thank you. I just want to repeat what my colleague Dr. McNaughton said earlier, to say thank you to the Board of Health for directing this air quality report, and also thank you to Toronto Public Health for creating this report and giving us the opportunity to engage on this matter. So just to reiterate, there's currently no regulation of indoor air quality, and our current ventilation standard, ASHRAE standards 62.1 and 62.2, that the Ontario Building Code relies on, was not designed to handle fine particulate air pollution and airborne pathogens. And so we don't have any legally enforceable standards that define clean and safe indoor air, and we don't have any indoor air quality policies or legislation at any level of government. And so that's led us to a situation where some places have an indoor air quality policy, but many other places don't. So for example, the City of Toronto has an indoor air quality policy for its offices. I'm just going to show you what that looks like. This is Appendix B of that IAQ policy, and you'll see that it shows actual ranges for IAQ parameters: carbon dioxide, CO2, temperature, relative humidity, and other air pollutants, carbon monoxide, formaldehyde. And this is based on ASHRAE 62.1. And so with the understanding that it's 62.1 only provides adequate air quality experts around the world gathered and published this landmark paper in Science in 2024 with proposed parameter levels that show what good indoor air quality could look like. So all of these pieces of information are out there. They are scattered over multiple sources. And what we're hoping to see as a next step, building on this report, is indoor air quality guidance that could be used by Toronto residents and by policymakers to create that framework. So this is just a mock-up of what that could look like in terms of guidance, to show people what is good indoor air quality, what's adequate, and what's poor. And this makes it very easy for a member of the public to take an indoor air quality monitor, go into a space, and then immediately make an assessment on if it's good, adequate, or poor. So leading on to that, we'd like to see a recommendation from the Board of Health to request that the medical officer help work with municipal licensing and standards, city planning, and other relevant stakeholders to develop that indoor air quality guidance for residents and building operators. As I mentioned before, the Ontario Building Code isn't up to date. It needs to be updated with the latest recommendations from ASHRAE, from Ontario Society of Professional Engineers, and other expert organizations. So we're requesting that this recommendation be sent to the province of Ontario to update the building code and to enact a Clean Air Act that regulates indoor air quality.
Thank you so much for your presentation. Any questions for Deputant? Seeing none. Thank you so much.
Chair, I have a question.
Okay, go ahead, Councillor.
Thank you, through the chair, to the deputant. Thank you for your presentation. I'm just wondering, whose responsibility do you think it is to set enforceable standards across the city and potentially the province and potentially the country. I think we lost her.
I'm not sure why we're having technical issues today with the system. She's still there. Dr. Hittinger, can you hear me?
Yes, I can hear you. Yeah,
Okay,
I'm not sure what happened. I got muted. Anyways, ultimately, like, legislative responsibility lies with the three levels of government, so municipal, provincial, and federal. But in terms of that starting point, the guidance, providing actionable, measurable ranges for all these indoor air quality parameters, that does have to come from public health. And that's just providing the information that's already out there. As I showed in that earlier slide, summing it all up in terms of what's good, what's poor, and what is acceptable air quality, and giving those actual ranges, because that is actually what's needed by policymakers and lawmakers to go the next step to create the legislation.
The city is currently undertaking an analysis about how to enforce temperature maximum for rental properties. And I'm just wondering, is this something you see the city enforcing in a similar fashion, that there would have to be an enforcement body that monitors and that helps landlords come to compliance?
Eventually, yes, a bylaw would be needed to enforce it. But at this point, I think next step after guidance would be a policy that's similar to the City of Toronto's indoor air quality policy, which itself is not enforceable, but it does give that framework for building operators to ensure that they are delivering, adequate air quality inside those office environments. If we have that policy in place, that's something that building operators across the city can refer to and know that, they are staying within those ranges, therefore they're delivering adequate air quality to building occupants.
And my last question is, I know that there's been strong advocacy about schools, and I'm wondering, have you reached out to teachers' unions? Is this something, for example, for the City of Toronto, our policy is coming through our gender and equity division that looks at our HR policy. So do you think that school, in terms of that advocacy for school spaces, could come through teacher unions, since the teachers, that is their work environment?
Yes, definitely. We actually connected with the elementary teachers of Toronto. They signed our petition, and they're strongly in support of this because, like you said, this is their workspace, and they are seeing the impacts of poor air quality across the schools within their classrooms. This is what they deal with every day. So they're also willing to collaborate in terms of, especially like the communication piece and helping to educate, not just within their own body of members, but also like the rest of the school community, the students and their families.
Thank you very much. Thank you.
Thank you.
Thank you. Heather Pun, are you here? Sorry, you have questions for the deputant? Okay, go ahead, Councillor Pursa.
I have a question as well.
Sorry. Okay. Dr. Hittinger, are you still there?
Yes, I'm still here.
Sorry, Councillor Pursa and Director Ozade has questions for you. So go ahead, Councillor Pursa.
Is it on when it's green? Okay, it's on when it's green. Geez, I almost forgot. You talk about policies or regulatory changes, but so for example, if you had some recommendations related to the Ontario Building Code today, what would you say that the building code needs to include in order to get good air quality into buildings?
So the recommendation, you'll hear more about this from Joseph Fox, who's who'll be speaking for Ontario's Society of Professional Engineers, is the building code needs to be updated to include ASHRAE Standard 241, which is control of infectious aerosols, and Guideline 44, published in 2024. And that's the guideline for controlling fine particulates coming from wildfires and prescribed burns. And those two pieces came about because ASHRAE recognized that Standard 62.1 on its own doesn't provide building resiliency to the impacts coming from climate change, human-made air pollution, and spread of infectious diseases indoors. So that does definitely need to be included into the Ontario Building Code. Now, just a caveat, that only helps with new builds that start at the time that this is incorporated into the Ontario Build. It's not retroactive, but at least putting it into the Ontario Building Code helps with directing retrofits and upgrades for older buildings, because then they have a target to which, to meet to. But again, like having indoor air quality guidance, which states actual ranges for IAQ parameters, would be a huge benefit for all building owners and residents across the city, because then that's something that they can easily measure and assess on their own. Is there a way for us to look at when properties are bought and sold, that some kind of an air quality assessment is done and included as part of the information piece with respect to the state of a property before someone buys it? I know that it could impact price. I know all of those things, but at some point there has to be an equalizer somewhere, and people should have a sense of knowing what they're getting into when they get into it. Have you thought about that, and have you looked at anything that could be done at that point in the property exchange and the property the people moving in and out of places and so on? Yeah, and unfortunately, this is a part of why we are advocating for a Clean Air Act, because right now, compliance with the ventilation standard ASHRAE 62.1, it's assumed, but it's never verified, not until somebody complains. And the example I want to give is in Kingston Secondary High School,
Final thoughts, please. You're over 3 minutes.
Oh, yes. Okay, yes. But that was a new build, probably only 4 years old, and a student found that it had really poor air quality, measuring CO2 levels between 2,000 to 3,000 parts per million, way over what the target should be, which is under 800. So that's just an example of where compliance wasn't checked. And we need a Clean Air Act to do that.
Thank you. Director Ozade, you had a question?
Yes. Thank you so much for this wonderful presentation you just gave. Are you able to share your screen again? I just had some questions on the recommendations that you provided.
I will need a screen share permission.
Just as an FYI, Director Ozade, I actually have an amendment to actually include this recommendations from Dr. McNaughton Hindinger. Okay, just so you know.
Okay, wonderful. It's just a general question. So I think you had some recommendations. You mind just giving slightly a bit more context on them, on what you hope they can achieve?
The first is the need for the indoor air quality guidance that states actual ranges for IAQ parameters. I'm just going to try and scroll back to show what that could look like. This is just a mock-up, and this is based on 5 references that we pulled. These are major ones. There are more references out there, so this could be, of course, quite a bit more fulsome, but this is just like a quick overview for the 2 main IAQ parameters we would be very interested in looking at, which is carbon dioxide level and PM2.5, fine particulates. And I've color-coded this, to make it easy for, a person from the general public to understand.
Okay, yeah, that looks good. Thank you, and I'm glad we're including some of those.
Okay, you're welcome.
Thank you. Next up is Heather Pun, P-U-N, online. Heather, can you hear us?
Hi there, can you hear me and see me?
Yes, we can. Go ahead, 3 minutes.
Great. I'm here to read for someone who cannot make it due to their disability. Hello, Toronto Board of Health. My name is Sarah Yun, and I'm a resident of Toronto. I have been mostly housebound due to myalgic encephalomyelitis, a post-viral condition incredibly linked to long COVID since my first and only COVID infection in 2024. I have since been forced to stay inside, mostly in bed, heavily fatigued. I can no longer work. I only exit my home when being driven to doctor's appointments, and the ongoing pandemic makes it unsafe to host my friends where I am. I have no idea when, if ever, I will be able to recover enough to work or go where I want to again. The number of myalgic encephalomyelitis patients have increased significantly since the COVID pandemic began. This condition currently has no straightforward diagnostic tests and no cure. Treatment is limited, hard to access, and often prohibitively expensive. I am currently on the waitlist for the Women's College Hospital's Environmental Health Clinic, which is currently now around 3 years long for a first appointment. As a person disabled from a viral illness whose infection may have been prevented if air quality was improved, I am sharing these experiences with you today to ask you to provide specific evidence-based indoor air quality thresholds in your report for action, which it currently lacks. We patients are sitting waiting for a grossly underfunded, ill-equipped healthcare system to treat us with the limited existing resources it has, while insufficient preventative measures pertaining to air quality contribute to more and more patients in need flooding in. In the meantime, working class patients with conditions like mine cannot afford rent and groceries due to an inability to work, and federal and provincial disability benefits not being adequate to cover the cost of living. Setting and clearly communicating precise IAQ guidance is a critical step for guiding the improvement of indoor air quality in our city, which would limit viral transmission and air pollution, and therefore decrease the number of people who develop debilitating conditions like mine that have and are currently pushing people into poverty as we speak. Thank you.
Thank you very much. Any questions of the deputant? Seeing none, thank you. Mason Fitzpatrick, you hear me? Here you go, 3 minutes, please.
Morning, Chair. Morning, board members. My name is Mason Fitzpatrick, and I work as Director of Communications for the Federation of Metro Tenant Associations. I'm also a tenant in Davenport. And throughout Toronto, wherever tenants live, they all pay rent, they all pay taxes, and they all breathe air. And because of this third point, our organization is ecstatic that the city and the board are taking this issue seriously and hope to improve air quality for all people in Toronto. We're particularly enthused by recommendation 2, which calls on the medical officer of health to work with partner organizations. And I can say for our part that when our staff go into buildings and meet with tenants, that they'll be happy to be part of this process of engaging with tenants and educating them about air quality. I'd like to appeal to you, however, to consider addressing a serious gap, which is, of course, as other deputants have noted, the lack of specific and measurable parameters for what constitutes clean air. We might save you the trouble in figuring this out, as Clean Indoor Air Toronto has pointed to already that standards exist internationally and at every level of government in Canada for what clean air is defined as for CO2, for ultrafine particles, and for other toxins. In fact, the city's indoor air quality guidelines for office environments already have a matrix for this, as was noted in the previous delegation. And it doesn't seem fair to me that people's safety or rights to safety should change from the time when they leave work and go home. And so, if these recommendations are implemented and serve as a scientific basis for a potential future clean air bylaw, that would greatly strengthen tenants' rights to file to the Landlord Tenant Board and take action against landlords who are not living up to the standards that they need. Because in the past, there's mounds of case law in which municipal standards have been used as evidence in LTB proceedings for things like health and safety, and I think that this would greatly strengthen tenants' abilities to protect themselves and keep things clean. Thank you.
Thank you very much. Any questions of Deputant? Saying none. Thank you so much. Mason, that was you. Joey Fox, online?
Hello, can everyone hear me?
Yes, we can. 3 minutes, go ahead.
Thank you so much. My name is Joey Fox. I'm a professional engineer, and I'm the chair of the Indoor Air Quality Advisory Group for the Ontario Society of Professional Engineers. We are encouraged with the steps that Toronto Public Health has taken with regards to indoor air quality. However, we feel there is some room for improvement. To adequately address indoor air quality, we must take steps to ensure people have access to clean indoor air. This would require a mechanism to test the air, determine if any pollutants are at harmful concentrations, and take actions to remediate if they are found in high concentrations. This is the framework of an Indoor Air Quality Act. We understand that TPH, it's not in their jurisdiction to enforce or provide an enforcement mechanism for acceptable indoor air quality, but it can provide guidance and a recommendation to implement an Indoor Air Quality Act. At minimum, TPH should provide recommendations for concentrations of air pollutants for people to know at what concentrations action should be taken. The other item is mitigating airborne disease transmission. ASHRAE Standard 241, Control of Infectious Aerosols, provides a framework to address this. However, places are not required to comply with the standard. For this to be implemented, it must be included in the Ontario Building Code. A recommendation from TPH to include ASHRAE 241 in the Ontario Building Code could go a long way. Similarly, there should also be a recommendation to comply with ASHRAE Guideline 44, which provides a framework to address wildfire smoke events. Dr. Ashish Jha, the former White House COVID-19 response coordinator, said, ASHRAE 241 is one of the most important public health interventions I've seen in years, if not decades. It should be the highest priority to have this implemented. Also, the report from TPH is geared more to residential spaces and not commercial spaces. Verified maintenance of HVAC equipment is also a requirement to ensure clean indoor air. As an industry insider, equipment is often not maintained, even when institutions and contractors claim it is. That's why maintenance must be verified through inspections and monitoring indoor air quality. In summary, TPH should provide maximum concentrations for various indoor air pollutants, recommend an implementation of an Indoor Air Quality Act, and recommend that ASHRAE 241 be included in the Ontario Building Code. Thank you.
Thank you very much. Any other questions for Deputant? Seeing none. Okay, well, that was the last Deputant on this item. Questions of staff? I'm sure there are questions of staff. Councillor Chang, go ahead.
Start. Is air quality enforceable? Is it something that the city can enforce?
The chair, we have guidance, and certainly I think that, you know, within the city, there's their own guideline for city buildings, but it is not something that we enforce unless it is considered a health hazard. And as we spoke to, you know, that there's very specific causes of a health hazard that we would enforce under the Health Prevention and Promotion Act. But broadly, as the deputants have spoken to, we don't have powers for a citywide indoor air quality standard.
Is there a body in all the different levels of government that would have jurisdiction to set a standard and then to monitor and enforce that standard?
To the chair, as many deputies have mentioned, the Ontario Building Code by the province would be a place where there could be new expectations for buildings under the Ontario Building Code to meet specific requirements regarding indoor air, and that would be, you know, likely the most comprehensive place within the provincial legislation to be able to enforce requirements.
There was a suggested motion through one of the deputants about the city coming up with a standard to work with relevant stakeholders and develop guidance, but that guidance would not be enforceable. Is that correct?
Yeah, to the chair, it wouldn't be enforceable. So certainly I think we've taken steps to that. I mean, we heard loud and clear the need for better communication. So creating an indoor air quality website on toronto.ca is a step to being able to explain what is indoor air quality, what are the health impacts, how can we address indoor air quality, and provide those links to existing guidance. So, Toronto Public Health, we're not going to rewrite the guidance that is already out there by Health Canada and others to say, here are guidance recommendations as been presented to say these are things that people can be looking for as information to be able to implement in their spaces, but we have no ability to enforce that. So it would really be for information only, that we're able to share that information, make sure people are aware of it and incorporating it where they can.
Do you know if the city's current standards internally capture both carbon dioxide and PM 2.5?
To the chair, I thank you, Councillor, for that question. I would have to actually go back to the guidelines, but the current city guidance is actually a bit dated. It dates back to 2016, so probably has not incorporated the most recent evidence and findings.
And my last question is about the city's policy on indoor air quality, that is for our buildings and by extension our staff and our users. Just wondering, is there a plan to update that policy? Because a lot has happened since 2016.
To the chair, thank you for that question, Councillor. That document was not created. Those guidelines were not created by TPH. We'd have to go to the other city divisions that were involved with the creation of that as to whether it be updated.
Great, thank you. Those are my questions.
Thank you. Going to recess for lunch until 1:30. Thank you very much. Enjoy your lunch. Meeting has now resumed. Hope everybody had a good lunch. So we were on item number HL 34.4, public health role in indoor air quality. We were on questions of staff. I know Councillor Chang spoke already. Anybody else have any questions on this item? Okay.
I've got a question.
Go ahead, Director Ozade.
Yes. So, yeah, over the break, I looked on the city website and pulled some figures. It said 94% of TPH indoor air complaints were residential. So I'm curious, is there a reason why residential housing is no more explicitly reflected in the recommendations?
So to the chair, I think the residential complaints are, typically where people have issues of mold or unusual odors. I think odors is probably the most common complaint that we have that we would investigate. So generally, they're not actually related to indoor air quality. Usually there's other factors that are associated with those complaints. So our inspectors will be in touch with those individuals, provide them other advice, and be able to manage those complaints by providing that education. It's not necessarily reflective of an indoor air quality issue in those places.
Okay, thanks. And then my second question is, do we have any evidence or threshold that would justify us revisiting Toronto's property standards as it relates to the ventilation and filtration maintenance?
Sorry, if you could just sort of say your question again. I'm not sure if I was following exactly.
Yeah, so if we had to revisit Toronto's property standards with regards to ventilation and filtration maintenance, do we have any evidence that would help us in doing that?
I think, we provide general advice to buildings. Most of the, public buildings would be under the Ontario Building Code, so they would be having to follow provincial requirements under the building code associated with that. There's not city property standards related to ventilation that are different than the Ontario Building Code.
Okay. All right. That's it. Thank you.
Thank you. Any other questions of staff? Okay, seeing none. We have a number of motions on this item. Speakers? I can start. Sorry, go ahead.
Does the motion need to be on the screen for me to speak to it?
Yes, you do.
Okay.
Is your camera on? Sorry.
Oh, sorry.
My mic was on. Okay. Go ahead and speak.
I can see what's on the screen. Okay, I see it now. Cool. Yeah. Thanks, Chair. I want to thank all the deputants, if there's any still there, because I could see that this issue had a lot of interest, which means that people are concerned about it. And over the break, I went to the city website and put some figures, one I shared already. The other one was that about 90% of urban Canadians spend their time indoors, right? And amongst people who live in Toronto that own a purifier, the main barrier was the cost and replacement. And these things cost around $30 to $200 every 6 to 12 months. And so I am still a renter. I've lived in a family-owned home. And for me, it comes down really to potentially a health equity issue, which is that clean indoor air should not depend on whether someone owns their home or if they can afford their own air cleaner. I think it was Representative Debbie King that shared a story about a youth wearing an N95 mask. And these things can help, but thinking about it from a systems lens, specifically social determinants of health lens, there's only so much that an individual renter can do, especially when they don't control the building maintenance, the ventilation or filtration, or even who to call if they have a complaint. And so this motion is asking the appropriate city divisions to see what the city can actually do within our local authority. I'm learning today that a lot of that the province has many of the powers when it comes to these, and I support the provincial recommendation. But it would be great if the city can look what we can do within our own jurisdiction so that ranchers are not left behind. That's it.
Thank you. Councillor Chang, you want to go next?
Sure, thank you, Chair. I also have a few motions. This is to promote and share our indoor air quality guidance as a resource. The city often leads by example, and since we do have an air quality guidance policy, that it's something that we can point to and share more widely with the rest of the city. And then my next motion. And this is to request the Chief People Officer, People and Equity, to work with Occupational Health Safety Coordinating Committee to update the policy from 2016, because we've learned a lot since 2016, and we should re-examine what that policy is. And lastly, to consider having a dashboard for city-owned buildings. This would help us lead by example. It would encourage other employers and employees to advocate for better standards, as well as more transparency in terms of air quality and work environments.
Okay, thank you. Any other speakers on the item? Okay, I'll speak to it. I do have a motion as well. And pull it up. And again, this is just adding a D to the recommendation that staff has brought forth. It's really around what the deputants were talking about, Dr. McNaughton in particular. I actually lost, I was so enthused by her presentation that I actually lost track of time. And of course, Dr. Hittinger as well talked about the standards, standards 241, and also to in regards to Sherry guideline 44.2024. It's around updating the Ontario Building Code to actually address some of these issues when it comes to aerosol and so forth. And so we know that we are living in a different kind of world right now in regards to air quality. You know, with climate change and fires and so forth, it's really have impacted all of us, not just the most vulnerable among us, young people and seniors, but everyone in between. And I think we have to adapt with the changing times, and I think policies need to also adapt as well. And I'm hoping that the province will actually take this seriously and follow the science. Following the science is so important. This is not a political issue, right? Let the experts in the room guide us as to what we should and should not do. And for me, as a councillor and chair of the Board of Health, I've always tried to follow the science and things. And this is a prime example of that. So again, thank you to Dr. McNaughton, Dr. Hittinger, and also to Mr. Joey Fox, the Ontario Society of Professional Engineers, for bringing the expert advice to us that helps us reflect the policies that we bring forth here. So with that, and all the deputants who actually spoke on this item, and not only today, but even over the last 4 years I've been here, people have taken time out of their busy lives to actually engage with us. And this is really the beauty of municipal governments, you know, in that people have the opportunity to actually come here and express their lived experience and living experience with us. So thank you so much for your time. And with that, I will ask staff to put the motions on the screen. Well, then we can. We have to do this individually. Nice try. First up is Director Ozade's motion. All those in favor? Opposed? Carried. Councillor Chang's first motion. All those in favor? Opposed? Carried. Councillor Chang's second motion is coming up. All those in favor? Opposed? Carried. And my motion. All those in favor? Carried. Item as amended. All those in favor? Carried. Thank you very much. Next up is item HL 34.5. Actually, let's go back to item 1 just to get out of the way. I think it was Director Ozode had a motion. I think we all spoke to this item already. Director Ozode, you want to speak to your motion? Is that?
Yes, if I can see the screen.
It's coming up shortly. Here it is.
Okay. Yes. Oh, thank you so much for staff for working with me on the wording. So the first one really is on. So the report shows that there's a lot of good work underway already, and that's great. So the first motion is just to ask that the update we're going to get next year tells us clearly what progress has been made, and I think, yeah, so there's a health equity component there as well. I wanted us to keep that because that's central to the strategic plan that we come up with. And it also helps the board to see any risks early instead of finding out later after something is falling behind. So that's on the first one. And then the second one is, yeah, so this one is about just connecting the strategic plan to the budget process, right? And I'm glad that we have, I think, 19 things that are on the pipeline already, so that's good. But if there's an action that may be at risk because of, whatever reason, staffing, funding, any resource constraint, I think it's better for the board to know that while the budget decisions are being made, and we're not automatically asking for more money from council or to commit to any particular decision. It just helps us get a clearer picture of the choices that we're going to be making and if there's any consequences attached to it.
Okay, thank you. You know what? No one spoke on this item, so any other speakers on the item? I'll just say thank you to staff for this comprehensive report. And thank you to all the deputants who came, especially our public health nurses, our frontline nurses who were here, who deputed earlier. I do empathize with them greatly. I see the work that they do each and every day, not only here at Public Health, but in my former life as a healthcare worker at a hospital, seeing the nurses working every day and putting their hearts and soul into serving our community. And so my commitment to you, of course, is to continue to support you in any way that I can. And, I will engage the mayor and her team, make sure that, in the next budget cycle that, you're compensated in a fair way. And that is my commitment to you today. Yes, with that being said, I will put the motion on the screen for this item. All those in favor? Opposed? Carried. Thank you. Item as amended? No? We're good? Okay. So we'll go back to item number 5, right? 5. HL 34.5, investigating the increased risk of heart disease, lung cancer, and tumors from bringing jets to Toronto's waterfront communities. And we have 22 speakers on the item, I believe. First up is Ingrid Boudet. Are you here with us? Is she online? Yeah. Okay, Ingrid?
Hello? There we go.
Here we go. I see you, Ingrid.
Great, thank you. I see you too, Councillor Moyes. Thank you so much, Chair Moyes.
I love your new haircut. Go ahead, 3 minutes.
It's summer, it's hot. Good afternoon, Chair Moyes and members of the board. My name is Ingrid Boudet, founder and executive director of No More Noise. I'm representing serious health concerns of thousands of Toronto residents. To date, our campaign has sent over 250 emails directly to this committee. These numbers represent a clear public health mandate from people who are demanding that this board step in and protect their communities from unprecedented health and environmental risks of a major airport expansion. I'm just quickly going to share my screen. And that one. So to understand our community's alarm, take a look at the true scale of this proposal. As my slide illustrates, the proposed 1,800-meter runway plus the 720-meter approach barriers creates a 3.24-kilometer installation on University Avenue. That is the distance from Bloor Street all the way down past Front Street. This will permanently destroy Hanlon's Point Beach, cut off vital public space, and devastate the local marine businesses that rely on safe, enjoyable waterfront. And now I'm going to just stop sharing again. This physical footprint also increases the already negative health impact. The current turboprop runway directly impacts the health and sleep of roughly 95,000 residents in the immediate downtown waterfront core. However, introducing commercial jets forces flat, low-altitude approach corridors that extend kilometers out. This expansion effectively expands the health risk zone by more than 250,000 additional people, stretching the acoustic footprint over 350,000 Torontonians, those are big numbers, from Mimico all the way to the beaches. Aviation data from urban airports like London City reveals that a single jet landing creates a peak noise spike of over 73 decibels, spanning nearly 4 kilometers from the runway threshold. With consolidated operations, that means a jet screaming over these acoustic zones every 3 minutes. The medical science here isn't speculative. The Landmark Ranch study published in PubMed explicitly proved that chronic aircraft noise causes severe deficits in children's reading and comprehension, delaying their learning by months. Furthermore, the massive NORA study on aviation noise proved that a 10 decibel increase in flight noise correlates to a nearly 9% spike in clinical depression and dramatically elevates long-term risks of stroke and heart failure due to nighttime sleep disruptions. We aren't talking about a loud background sound. The global medical literature explicitly warns us that introducing a jet corridor to over 350,000 residents is a recipe for a public health crisis. This is not an issue the board can ignore. We strongly support the City Council's urgent directives under MM 41.19. We demand the medical officer of health immediately fast-track the collection of jet noise impacts. We request that the board formally urge the federal government to update regulations to enforce strict safety standards for noise pollution. The province is attempting to bypass municipal oversight, but they cannot declare a special economic zone over the human heart or our children's developing brains. Stand by your directive, demand a comprehensive Health Canada study, and protect the over 350,000 residents relying on you. Thank you.
Thank you so much for your deputant. Any questions for the deputant? Seeing none. Thank you, Ingrid.
Thank you.
Yes. Greg Evans, you here? Online? Greg Evans?
Yep, I'm here.
Here we go.
Thank you.
3 minutes, go ahead.
I'm just going to share my slides. Can you see that?
We can. Go ahead.
Perfect. Okay. Thank you so much for the opportunity to speak. My name is Greg Evans. I'm a professor in engineering at the University of Toronto. I'm the director of the Southern Ontario Centre for Atmospheric Aerosol Research, and I'm one of the co-leads of the air quality study that was done in the Bathurst Quay neighborhood. I'm going to use this opportunity just to familiarize with information on the current status and then indicate what the growth in the airport might cause. So the study that we did was over 2.5 years. We made many measurements, but the key things I'll talk about today, if you can see my cursor, we made measurements in the Bathurst Quay neighborhood. We had 4 sites. I'll talk about the Arcadia site, which is to the north, the ferry terminal site, which is to the south, and these effectively bracket the exposure that the residents of the neighborhood have. I'll also be talking about how the air comes from the south, goes across the airport, and the emissions from the activities on the airport impact the community. So what does that look like? Well, here's a slide. I'll try to, if you can see this, I have some black lines here, which are the concentrations on a typical arterial road in downtown Toronto. Usually it's about 15,000 particles per cubic centimeter is what people inhale there. And that means every time they take a breath, they're inhaling 15 million particles. If we add on what it looks like to the south or to the north of the neighborhood in Arcadia Court, you can see much higher concentrations peaking up to about 100,000 particles per cubic centimeter. And these little spikes, these are individual aircrafts landing and taking off. And these are seen in the neighborhood when the wind is blowing from the airport. If we go to the north of the airport, we see the spikes get well over 200,000 particles per cubic centimeter. So these are quite high concentrations, and there's many more of them. But again, it depends upon which way the wind is blowing. So to summarize this, when the wind blows from the south, the concentrations are about 2.5 to 3 times higher than when the wind is from the north. And when the wind is from the north does include the contributions from the City of Toronto, basically the air quality in the Bathurst Quay neighborhood and all the neighborhoods along the waterfront would be much, much better if the airport wasn't operating. So what does this mean? Well, I'm just going to share a couple of the health impact studies that have come out in the last 3 years, just to emphasize how quickly this field is evolving. So we now know that exposure to ultrafine particles is associated with increased cardiovascular mortality, respiratory mortality, cerebrovascular mortality, neurodegenerative mortality, lung and brain cancer, offspring autism, and bronchiolitis puffer use. The latest study
that is 3
suggests...
minutes. Can I get you to wrap up?
Sure. The implications are that Billy Bishop's already impacting the air quality. If we increase the flight activity, it's going to increase exposure along the waterfront for all the communities along the waterfront. We can hope to improve air quality in Toronto for electrification of vehicles, but whatever we do with the airport now is going to be persisting for the coming decades, and this will increase the...
Thank you. Eric Woodley.
Question of the professor. Questions of the professor. Yeah. May I ask?
Yeah.
Thank you. Through you. Professor, good afternoon, and thank you for your presentation. I'm just wondering, with respect to Pearson Airport, do you have the same comparative analysis, or is it because this airport is located in an area in terms of proximity to the residential community? You're muted. You're muted, sir.
Sorry. The residential community near Pearson is in Rexdale is further away.
Okay.
But there are impacts being seen there as well. And again, it depends upon which way the wind blows.
Okay. So your presentation to us, it's about proximity, but at the same time, you still have challenges that is similar to what you are presenting to us with respect to this area close to Billy Bishop that is similar to residential area near Pearson?
I'd say near many airports globally. Certainly, there's Cape Tow is one, LAX is another one, Boston is another one. So where studies have been done, they're seeing the same effect, and it depends on the wind direction and how close the community is. On the Toronto waterfront, the community is very close to the airport.
Got you. But the average person hearing many of the presentation and presenters may find that it's just unique to Billy Bishop, but you're saying it's unique to airports globally.
It is. It relates to airports globally, and for that, the Civic Aviation Association, International Civic Aviation Association, is looking at putting in emission standards for ultrafine particles from aircrafts, but those probably will not be implemented into actual planes it'll take a decade. So this is not just Billy Bishop, but I focused on Billy Bishop because that's where we did this particular study, but we have studied at Pearson as well.
So air traffic and air pollution and as it relates to aviation is a problem, although there are convenience that's provided globally for people who are traveling and flying, but there are conditions that are problematic and in fact it's an endangerment to life.
It's an endangerment to life, but let me be clear, the thing that is different about aircraft than, say, our cars and our trucks is that they emit a lot of ultrafine particles where other pollutants come from other modes of transportation.
Fair enough. This is very helpful. Thank you very much, Professor. Thank you, Madam Chair.
Any other questions? Nope. Okay. Thank you. Thank you for coming in and speaking.
Great. Thank you very much.
And Eric Woodley, welcome. You have 3 minutes to speak. When you're getting close to your time, I'll let you know.
Okay, thank you. Can you hear me? I'm a resident of the Waterfront, and when I moved to the Waterfront 20 years ago, just across from the island airport, where quite a bit of affordable housing had been built, unexpectedly a doctor said to me, "The air should be good there with the effect of the wind from the lake." At the time, the air seemed indeed breathable, despite the close-by presence of Lakeshore Boulevard and the Gardiner Expressway, which together effectively meant living closely adjacent to a 12-lane highway. Being daily exposed to constantly increasing air pollution is not unlike losing one's sight, in the sense that it is difficult at first to notice. Not unlike the kid who doesn't know he's losing his vision until he has to sit in the front row to see the blackboard. One afternoon during the COVID crisis, sometime after all commercial flights had been suspended from Billy Bishop, I became aware of just how bad the air pollution produced by the increase in the use of this airport had become. On this afternoon, the air was clean again, breathable, more like it had been years before. The effect of the cessation of commercial air traffic was almost inconceivable. I felt as though I had moved to the distant countryside, so dramatic was the change. Once the planes began to fly again, it was clear just how poor the air actually was. And in the time that I've lived on Queens Quay West, flights that could be annually counted in the tens of thousands are now in the millions, and to be doubled to a projected and shockingly inappropriate 4 million jet flights per year. In fact, despite not smoking or being exposed to any workplace respiratory hazard, in the past several years I've developed asthma and lung disease. Often my lung capacity is around 50 to 55%. My respirologist is running extensive tests for lung cancer. I think it is safe to say that if instituted, the significant airport expansion that is being proposed will either mean my life or, at the very least, I will have to leave my hometown, the place where my grandmother and mother were also born, and where my life exists most fully. I'm sure I'm not alone in these problems and reasonable conjecture. As former Mayor Crombie has said, the airport expansion will undo 40 years of work on the waterfront. In terms of public health, lived experience and common sense tell us that this undoing will have profound and dangerous effects on the health of many citizens of all ages and incomes who live here, live there, and in proximity to the airport. Thank you.
We're at 3 minutes. Thank you.
If there are any comments that I can answer, I'm happy to answer them.
Deputant? Okay, I see no questions. Thank you. Thank you for coming in.
Thank you.
Next, I have Tim Fitz-McGuire. Welcome. You have 3 minutes to speak.
Good afternoon.
I'll let you know when you're getting close to your time.
Thank you. My name is Tim McGuire. Some in the room might know me as former president of QP Local 79, representing city workers. I'm here today on my vacation. A personal perspective, my perspectives do not sync with any, do not represent the interests of any organizations other than myself. So Toronto is a balance of what it is today, both the beauty of Toronto and its imperfections at times, but that balance is achieved through places like this. So institutions, anti-poverty groups, community organizations, trade unions, and others can come and present various perspectives, and then a balance is reached. And specifically, the balance of land use on the lakeshore arises from these democratic institutions. However, Doug Ford has declared Bill 5 will apply to what happens at Billy Bishop. Bill 5 and C5 federally seek to override local institutions, environmental assessment, and Indigenous consultation. So I urge the city to challenge that perspective and say that to the federal government that Bill 5 and C5 decision-making framework should be rejected completely. And I'm also here to say that there should be a broader approach than simply not simply, but the two physical health issues in the title of this consultation, in this meeting today, including health and safety. My oldest brother, Dean McGuire, was a sheet metal worker, and he died at Billy Bishop in March of 2018 from a completely preventable workplace tragedy. The provincial government has taken a cursory look at the results of recommendations from the Coroner's Inquest and ignored most of them. What would we do if Bill 5 applies and we don't know what the standards will be related to health and safety? Will there be corners cut in building new buildings, et cetera? I think we should be worried about that. Secondly, green space and recreation and mental health. We don't have to reinvent the wheel with this necessarily. The city itself did a report in 2015 called Green City, Why Nature Matters to Health, and Evidence Review. 160 studies were looked at, a systematic view. So please take a look at that. And from my personal perspective, my mental health over the issues that were happening in my life and during the pandemic were protected because I had access to the lakeshore. I have years of using the lakeshore. Thirdly, Indigenous consultation. I think the Indigenous communities should be consulted directly on health impacts. They will have a different perspective, and we shouldn't just assume what those might be. And finally, there's a term, Morganization. The firm that has been known now to have lobbied levels of government on the Billy Bishop Morganization is about monopoly control, and we should be concerned about our lakeshore, our waterfront should not be Morganized. Thank you.
Okay, thank you so much, Tim. Any questions for the deputant? Seeing none. Thank you so much.
I've got a quick question.
Go ahead.
Yeah, thanks, Tim. I noticed you mentioned mental health, and I know this is supposed to look at lung cancer and other things. What specifically do you think the board can do with the information you've just given us?
Well, I did refer to a report that the city did now 11 years ago. I think that should be revived and maybe updated or whatever. But there's already 106 recommendations. I know from my life during borderline depression period, both pre-pandemic and during the pandemic, the lakeshore mattered. I have 30 years of enjoying the lakeshore, walks, runs from Humber Bay all the way over the beaches, but specifically around Harborfront. And that has allowed my mental health to keep stable and improve because I have access to that. And I think others would feel the same. So the city should look back at its report from 2015 at the connection between green space and broader recreation. Now, the recreational activities on the lakeshore around Waterfront, et cetera, kayaking, canoeing. There's a bunch of yacht clubs on the lakeshore. I think someone said earlier 350,000 people would be impacted by what happens at Billy Bishop. Look at their physical health impacts. Look at their mental health impacts by having jets rather than the current balance that's at Billy Bishop.
Okay. Thank you so much, and thanks for sharing and for mentioning this mental health aspect as well.
You're welcome.
Yep, thank you. Next up is Tamara Extian-Babiok. Tamara Extian-Babiok. No? Okay. Joanne Prowse?
Hello, it's Joan Prowse. And welcome, everyone. Thank you very much for having me speak today. I live in the Bathurst Quay neighborhood. We are the closest neighborhood to Billy Bishop. Some of our residences are 350 yards away from the runway. We are a mixed income community, which means that we have Toronto community housing, we have co-ops, and we have condos. And we have a very, very dedicated and active community. One of the things we've been most active in is trying to curtail the expansion of the airport. Dating back to 2003, which is when I became involved in this volunteer organization, we've been successful. And in 2013, after the medical officer's report on the jets, we were recommended that there be more air quality testing done. So our neighborhood association sought help from Toronto Public Health, from the Ministry of Health, and then eventually, and we weren't really given much support, eventually we landed on the University of Toronto's Transportation Air Quality Research Team, who you've met, Greg Evans. His study is, the study that they did was very comprehensive. He said 2.5 years. It actually began in 2019. It wrapped up in 2022, the testing. The report came out in 2024. Very little has been done to look at that research study and its findings. Its key finding was a surprise to our neighborhood and to the researchers as well. And the fact that the airport is the key contributor to ultrafine particles in our neighborhood. Now, it's just the area that our neighborhood was tested. But if we test to the east or to the west, depending if the winds are coming from the direction of the airport and that direction, not to the southwest, which is in our neighborhood, you probably find similar findings. So we have a number of people that have put in written deputations who, there's one person that supplied a video, there's other people speaking today, but I urge you to please read those written deputations. There are many, many people in my building, which is Arcadia Co-op, 350 meters from the airport, that have died from cancers, who have dementia, who have lung problems. This problem has been going on since 2003, was brought to the attention of the Medical Officer for Health in 2013, which stopped the jets. Here we are in 2026. We now have the findings that actually show the relationship between the airport. And if you add jets to the already health problems that are derived from living so close proximity to this airport, I guess our recommendations coming from the Bathurst Quay Neighbourhood Association is to please pay attention to the University of Toronto's Bathurst Quay Neighbourhood Air Quality Study. It's online. You can go to our website, bqna.ca, the University of Toronto's website. You can find the findings. The university, this same research team is now collecting data currently this summer. They were doing it around FIFA, but there is air quality testing that's taking place now. And I would just want to say that this study was funded by NSERC. We included Billy Bishop Airport as one of the partners, as well as Toronto Public Health and the Toronto Waterfront Secretariat. We were inclusive. We weren't just in.
Thank you. Any questions for Deputant? Okay. Next up is Connie Clement. Online. Connie, can you hear me?
Yes.
Okay, 3 minutes. Go ahead.
Thank you. Sorry, I thought it's totally in your control. Thank you. Good morning, Chair, members of the board, Dr. Murty and staff. Some of you may know me through public health. I was the first public health planning and policy director following amalgamation in Toronto. I retired from public health as the scientific director of the National Collaborating Centre on Determinants of Health. I'm also speaking to you today as a 43-year Toronto Islander. I thank and commend Council and Board for using municipal authority to help our city understand and to avoid the widespread damage that would result from the expansion of Billy Bishop Airport. Evidence demonstrating aviation-related pollution impacts, including but not limited to the ultrafine particles emitted by jets, speaks for itself, and I thank other presenters for detailing such impacts today. I urge TPH to fast-track implementing the 2 initiatives put forward. I encourage and will count on the board to build on your excellent 2013 report. Please don't start from scratch. Look beyond chronic disease. Integrate evidence about neurologic, metabolic, mental health impacts stemming from noise, water pollution, traffic implications, occupational, passenger and standby safety, loss of recreational space, and the limits of existing mitigation methods. Analyze population level well-being and the systemic factors that influence health impacts vis-a-vis the proposed airport expansion, not just individual impacts. Bring a forceful lens, please, to your equity analysis. We know that children, pregnant women, and those living on low income suffer disproportionately from pollution. Fulfill your commitments to Indigenous peoples through high engagement. I encourage you to analyze impacts on non-humans. Although Toronto has not taken strong positions to date in relation to One Health approaches, the WHO and CPHA paved the way for the board and TPHA to do this. Erosion of the environments in which we live influences humans and the non-human, and that circles back to influence us. I was asked by Toronto Islanders to bring an island voice today. As airport neighbors and as harbor and park defenders, Islanders have deep concern about the proposed airport expansion. We're counting on the City of Toronto, including TPH, to bring a rational, future orientation and a precautionary perspective to Billy Bishop's future. We need public health to defend our health from multiple harms implicated in expanding Billy Bishop to accommodate jets, and equally to safeguard the gem of a waterfront that Toronto's created with long-standing multi-government investment. This is not a NIMBY issue for us. This is an issue for all Torontonians, and in fact, Ontario and internationally.
Thank you so much.
I only have 2 minutes on my timer on my iPhone, but I respectfully ask you to endorse and implement the.
3 minutes only. Any questions? Any questions for
It's been a pleasure to watch.
Thank you so much.
Thank you.
Tamara, Extian Babiuk, I heard you now online. If you
Can you hear me?
Yes, we can. Go ahead. 3 minutes.
Okay. Okay. Thank you very much. I appreciate it. Sorry, I couldn't, there was no volume before when I was trying to speak. It wouldn't let me join by phone. So I'm a downtown area resident. I have a young son. I'm very concerned about the health effects on children and on other vulnerable downtown residents. There are 6 schools in the airport's hazard zone. And in addition to children being especially vulnerable, so too are seniors, unhoused folks, and uncompromised folks. We actually have close friends who already can't visit our area because of health issues combined with the air quality. So from a health equity perspective, I'm extremely concerned about our most vulnerable residents of our society. Also, in our area, we have the lowest per capita green space in the entire GTA. Of course, having that green space is important for health and wellness, which obviously, could mitigate some health issues. Also, in terms of emergency preparedness, speaking to your earlier topic, in the event of a future pandemic, the Waterfront, Little Norway Park, some of those open downtown spaces were some of the only spaces I was able to take my son and feel safe during the pandemic. We have very little space in this area for social distancing. I'm sorry, I don't know why my face is not centered on here, but anyway, we have very little green space available for social distancing here. It's important to preserve these spaces. That's of a much greater need in such a densely packed neighborhood as downtown is than an additional airport and further development in commercial space. In addition, buildings in this area, I don't feel they have adequate air filtration or soundproofing to keep residents safe. Bringing commercial jets to an area where the housing has not been built in accordance with providing safe air quality and noise protection seems extremely reckless, especially in such a dense neighborhood, again, where there are tens to hundreds of thousands of residents. Also, I think, a study is extremely important of the health effects for downtown residents. I would also urge you, in addition to looking at health, disease, lung cancer, and tumors, to look at some of the other issues that have been shown to be related to jet emissions, including airway lesions, asthma and other respiratory issues, dementia and cognitive decline, diabetes, hearing problems, insomnia, anxiety, high blood pressure, and stroke. So there's just an absolute litany of terrible health effects. And again, this would be a huge number of residents who would be exposed to all of these pollutants on a daily basis. In addition to the air pollutants, I recently learned that we get most of our potable water from Lake Ontario. So I'm deeply concerned about air emissions that will both be falling into the water and then about any possible runoff from the actual, the airfield. I had learned that there was some flame retardant foam which had leaked at Pearson, and much wildlife in the area died as a result. So I'm wondering if we had a flame retardant foam leak in a downtown airport, would it be residents then dying because of those toxins? I don't think our filtration systems are designed for this level of heavy environmental pollutant that could come from like a retardant foam or some of the other industrial products being used at the airport. Thank you.
Thank you so much. Any questions for Deputy? Seeing none. Emily Simic? Online? Emily?
Hi there. Can you see and hear me?
We can hear you.
Oh, okay. I guess my camera is not working. I'll just proceed. Okay. So I'm joining as a resident of Toronto. I live and work in Toronto. I'm also representing neurodivergent community with chronic illness. I'm diagnosed autistic ADHD. I have a litany of associated co-occurring health issues like asthma, mast cell activation disorder, dysautonomia, endometriosis, sensory issues, anxiety, depression, chronic fatigue syndrome. I can go on, but we'll be here all day. So I just wanted to really quickly go into the fact that people who live with chronic illness who are neurodivergent don't always have the interoception and the capacity to express what they are feeling or going through. For example, as a child, I experienced severe PANDAS, which is pediatric autoimmune neuropsychiatric disorder associated with a streptococcal infection. Essentially, the air pollution from the coal-powered Lakeview power plant that I was living a mere 20-minute drive from in Mississauga caused me to have a secondary lung infection on top of my already seasonal allergy infections and childhood asthma, which went on for about 3 months, only post-diagnosed by a doctor 3 months afterwards as a lung infection. And this was a very traumatic moment for me as a child, not being able to express the distress and the trauma of undergoing an event like this, which was a layer of effect, chronic health conditions on top of smog days and coal-powered pollution. Essentially, we have, all kinds of particulates. This is now outlawed. We don't have a coal power plant. The Lakeview has since been decommissioned, thank goodness. As a child, I was sweeping out and cleaning my room very frequently for allergens, and I would clean my windowsills, and I had a very thick layer of coal dust on the windowsill, which I would constantly be removing. And it was just a reminder to me that air pollution is visible. We can see it. There is a remnant, not only just in our air, but we can see it on the ground. We can see it, and this is going into our bodies. As an adult today, I am distressed by the fact that I have to monitor and be hyper vigilant for air quality in Toronto. I have 6 tabs open on my computer currently to track air quality. I subscribe to following the Weather Network on their air quality and pollen pages. I watch AccuWeather.com for their indoor air quality. I also look at climatetrace.org, which is a very good website. It tracks in live time the major pollutants in Ontario and globally. You can see global pollution on climatetrace.org. Please look it up. Firesmoke.ca tracks the current wildfires, which now I have to be vigilant about. Experienced a very bad episode with the last crisis. Air quality Ontario.com and weather.gc.ca.
Thank you so much for your deputation. Any questions of deputant? Seeing none. Thank you very much, Emily. Next up is Dr. Millie Roy. Online.
Can you hear me?
Yes, we can. 3 minutes. Go ahead.
Okay, thank you. I just want to share some slides.
Okay.
If possible.
You have been given presenter status. Go ahead.
Okay, thank you. I'm just going to try to get them on here. Sorry. They're not coming up.
If not,
I apologize.
If not, just speak to it, please.
Okay, got it. It's failing. Okay, I'm just going to go ahead. I apologize. I had some slides prepared. I'm Dr. Millie Roy with the University of Toronto, and thank you for the chance to address the board. I'm speaking as the co-chair of Cape Ontario. We do have concerns regarding the jets at Billy Bishop, and in particular, the emissions of concern include the ultrafine particles, UFPs, which make most emissions from jets, as well as toxic gases, NO2 and SO2, and noise pollution. We know that with UFPs, there's direct uptake through the lung and the gut, leading to links with lung disease, such as asthma and chronic inflammation, also cardiovascular disease, including deaths due to things like heart attacks and heart failure. When these pollutants are taken in through the nose, they travel up the olfactory nerve with direct access to the brain and are linked with dementia, stroke, and Alzheimer's. And UFPs are also linked to diabetes, lung cancer, and pregnancy risks, such as low birth weight and birth defects. And there are also concerns with the emissions of NO2 and SO2, so nitrogen dioxide and sulfur dioxide. We know a lot of the risks of those gases already, links to premature death through mechanisms such as lung and heart disease, lung cancer, diabetes. They're also linked to pregnancy risks and neurodevelopmental delay. And we know that there is no safe threshold of exposure for the NO2 and SO2. There are also concerns over aviation noise pollution, which are strongly linked to heart disease. We have meta-analysis data on that, as well as impaired cognition, other mental health impacts, and also impacts on children's health, including ADHD and deficits in reading and memory. And in addition to that, I'd like to share the first ever study that was done looking at the health impacts specifically due to aviation UFPs in Europe 2024 that linked exposure to hundreds of thousands of cases of high blood pressure and diabetes, as well as dementia. This showed that the highest risk is people who live within 5 kilometers of airports. And we have about 450,000 people living within 5K of Billy Bishop. And this is on the rise. There's also one other excellent study that identified 1,100 deaths in Toronto and Montreal specifically due to UFPs, and showed Billy Bishop to be the largest source of UFPs in the city, with neighborhood levels exceeding safe levels. And in conclusion, we asked the board to please conduct a health impact assessment study, as there's been a lot of new information that has come to light that I've tried to share here since the last report in 2013.
Thank you so
much.
much.
I thank you for your attention.
Thank you. Thank you. Go ahead, Councillor Chernoslin. There's a question for you, Dr. Roy.
Thank you for your deputation. I just wondered, with respect to UFPs, SO2 and NO2 gases, are these different when they're in jets versus propeller planes or the types of planes we currently see at Billy Bishop?
You're on mute, Dr. Roy.
There we go. So thank you for that question. And of course, I'm not an engineer, so I'm not going to have, a lot of detail. But what I can tell you that we are aware is that the turboprop planes actually produce less emissions overall. In fact, up to 30 to 50% less than a jet plane engine. So if you're looking at the absolute level of pollutant, I'm not aware of differences, that would arise due to the source of the emission, whether it's coming from a turboprop or a jet plane. But we do know that jet planes produce more emissions per mile or kilometer flown for short hauls in particular.
And with respect to noise pollution, because sometimes we hear in sort of the press for the opposite view that the new jets are quieter than the current planes that are there. Has there been any have you guys done any research sort of on whether, I don't want to say whether things would improve, but is there less risk in terms of noise pollution? Presumably there'd be more frequent if the number of flights are increased, but presumably, I guess what I'm getting at is I'm just wondering if you have any thoughts on what the impact would be, because there's so much mixed. I think part of the challenge is we don't really know because there hasn't been we haven't seen any data on what's being proposed, the new jets versus the prop planes, but we hear stuff sometimes from the other side saying, oh, these are actually quieter. So if we're thinking about the noise pollution, how does this play into it?
Right. And again, these are excellent questions. And I think the very first thing that all these questions point to is the need to pause and properly do a health impact assessment that addresses all of these questions. What I do know about the turboprop planes is that that the 3 propeller planes are quieter than those that have 2 blades. Again, I'm not an aviation expert, but there are quieter planes amongst the turboprops as well. And of course, one of the big concerns with noise is, as you alluded to, the plan that we're hearing to quintuple the volume of passengers carried through Billy Bishop to up to 10 million passengers. And that, of course, is a huge concern in terms of noise pollution.
Thank you.
Thanks very much.
Next up is Diane Jameson. Okay, 3 minutes.
Thank you. Chair and members of the Board of Health, my name is Diane Jameson. I live on Toronto's Waterfront, near Billy Bishop Airport. This is an action item, so I'm asking the board to act. In 2013, this board required a rapid health impact assessment associated with Billy Bishop Airport expansion because noise, environmental, and traffic studies were not enough. The medical officer of health recommended that any change to airport operations or associated transportation infrastructure should ensure that existing health packs are reduced. The peer-reviewed University of Toronto air quality study, in which the City of Toronto and Ports Authority participated, identified the airport as a major source of ultrafine particles in the Bathurst Quay neighborhood. These particles, as you've heard, can penetrate deep into the lungs, into the bloodstream, and affect the cardiovascular system and other parts of the body, contributing to heart and lung disease and some cancers. The study also provided critical evidence of local air quality without the airport's contribution during COVID. That was not a complaint or a survey, it was evidence. We also have a peer-reviewed McGill Health research on ultrafine particles and premature death. Known evidence should trigger assessment, protection, and action. RESA is being presented as a runway safety project. But runway safety is not the same as public safety. Airport status should not be treated as a public health exemption. There is no independent health impact assessment, no integrated public safety assessment, and no clear, accountable RESA protection framework for noise, traffic, emergency access, construction impacts, and cumulative effects. The evidence is known, the gaps are documented, and the duty to protect the public is clear. Yet RESA construction is moving ahead before independent assessment, accountable oversight, and the public protection has been established. I am asking this board, the Medical Officer of Health, to report publicly before RESA construction proceeds, and to call on every level of government to use every law optional available to pause construction until public health, public safety have been independently assessed, publicly reported, and protected. The first duty of government is for public protection.
Thank you
not
so much.
Protecting an airport from public accountability, and thank you for listening.
Thank you. Any questions for the deputant? Seeing none. Thank you so much for coming today. Anne Curry. Oh, 3 minutes.
Thank you. My name is Anne Keary. I'm with the Canadian Association of Physicians for the Environment, where I support healthcare professionals, such as Millie, advocate to protect human health from environmental harms. I'm here today to urge you to pass a motion directing the Medical Officer of Health to proceed with a health impact assessment. The provincial government's proposal to expand Billy Bishop Airport to accommodate commercial jets and scale passenger volume from 2 to 10 million per year represents a major threat to public health. As you heard from Dr. Roy, commercial jets generate 30 to 50% more carbon emissions per passenger mile than turboprops and generate significant pollution. Ultrafine particles, nitrogen dioxide, and sulfur dioxide. As many here have noted, ultrafine particles are of particular concern. It bears repeating, they are so small they pass directly through the lungs and into the bloodstream, causing multi-system diseases. UFP exposure is a documented driver of asthma, heart attacks, lung cancer, and stroke. UFPs can even travel via the olfactory nerve directly into the brain, bypassing the blood-brain barrier, a pathway associated with dementia and Alzheimer's. We know from the University of Toronto study spoken to earlier that UFP levels near the airport are already high and well over WHO guidance. Bringing in large numbers of commercial jets would dramatically increase the frequency of dangerous spikes in UFP levels, impacting the health of hundreds of thousands of people. And this is the point. What makes Billy Bishop uniquely hazardous is its proximity to one of the densest urban areas in Canada. While Pearson Airport has roughly 130,000 people living within 5 kilometres, Billy Bishop has over 400 to 450,000 residents within that same radius. Studies from Europe that Millie cited show that pollution from aviation facilities directly impacts the health of residents within a 5-kilometre range, raising the risk of diabetes and dementia by 20%. Also, Billy Bishop Airport is located, unlike Pearson, within 500 metres of 3 schools and a childcare facility, exposing developing children to severe air and noise pollution, which could mean lifelong cardiovascular risks and permanent cognitive deficits. Add to this the impacts of climate change. More heat means the generation of more dangerous ozone. Given then the serious and far-reaching risks to human health that airport expansion presents, the Board of Health must act.
Thank you.
The Board of Health has a mandate to protect and promote the health of Torontonians.
Thank you so much. Any questions for the deputant? Seeing none. Thank you so much. Bashar Kasser. 3 minutes, please.
Good afternoon, everyone. My name is Bashar Kassir. For full transparency, I'm a candidate for Ward 10 in the upcoming municipal election. Excuse me?
Is your mic on?
Yeah, it's green, sir.
Okay, just speak up closer to it or louder.
Okay. So for full, shall I restart or just continue?
Continue.
Okay. Chapter 591, the noise bylaw, has been undermined by exemptions. The city has the scientific evidence. What has been missing is the consistent application of that evidence through effective enforcement. The airport has generated chronic noise for many years, yet enforcement and policy have not always reflected the health impacts now being acknowledged. This board has to ask an important question about the integrity of its finding. My concern is about consistency. If exemptions continue to be granted for other significant source of chronic noise, what assurance can residents have that future airport noise will be treated differently? Public confidence depends on applying the same principles consistently. I'm here to support this motion. Protecting residents' health and quality of life should be at the very heart of every decision involving environmental noise. If the city believes aircraft noise may contribute to increased risk of heart disease, lung cancer, tumors, sleep disruptions, and adverse health outcomes, then it must apply that same health-based approach to all significant sources of chronic environmental noise. Ultimately, this is about protecting residents' quality of life. Chronic noise affects our sleep, our health, our ability to enjoy our homes, and our overall well-being, regardless of where that noise originates. If this board concludes that chronic aircraft noise deserves investigation because of its potential health consequences, then council should also recognize that chronic noise from other exempted sources deserves the same public health consideration. Residents do not experience health effects differently depending on whether the source is an aircraft, a garbage truck, makeup air unit, mechanical fan, or diesel generator. The body responds to chronic noise exposure regardless of its origin. All of the noise, these noise sources have the same adverse effects on our health. Residents expect policy decisions affecting public health to be based on evidence and applied consistently over time. While I support this investigation, I ask the board to ensure that its recommendations are guided by a simple principle. If chronic noise is recognized as a public health issue, then every significant source of noise should be evaluated through the same public health lens. Toronto cannot acknowledge the health impacts of one type of noise while exempting others from meaningful scrutiny. The city needs to be clear, transparent, and accountable. Protecting residents' quality of life means applying the same evidence-based public health standards to all sources of chronic noise.
Thank you so much.
Okay, thank you.
Thank you. Any questions, Deputy? Seeing none. Up next is Monica Sovbinska. Monica? Not here, not online. Kate Dupuis. Kate Dupuis. Oh. Is online. Kate. Hey, can you hear us?
Hello.
There we go. 3 minutes.
Hi
please.
there. Thank you for the opportunity to speak today. I'm a psychologist, a researcher, and a longtime resident of Ward 19 in Beaches, East York. My husband and I are raising our 2 children in our beautiful lakefront riding. Now, I have previously spoken to the Board of Health concerning the importance of providing clean indoor air, with a particular focus on congregate spaces such as schools, childcare centers, and long-term care homes. Today, I'm speaking with you about the importance of quality outdoor air and the potential impact of the proposed expansion of Billy Bishop on air quality and noise pollution in Toronto. While there are, of course, concerns around the impact of this proposed expansion on water quality in the Inner Harbour and Lake Ontario, I will not speak to this today as it does not directly pertain to the current motion. Now, ample research, as I've heard from many of my colleagues here, has demonstrated that living in an urban setting has immense impact on health and well-being. Data clearly show the connection between poorer air quality, elevated levels of air pollution, increased risk of all-cause mortality, specific diseases including stroke, heart disease, hearing loss, psychological distress, and cancer. Many of these diseases are themselves actually major risk factors for developing dementia. It is crucial that the Toronto Board of Health make decisions to help promote healthy living and that the board advocate for conditions that improve health for Toronto residents. However, given that the Toronto Waterfront is also visited by nearly 30 million people every single year, the Board of Health's mandate must now extend to protect the health and well-being of visitors to our beautiful city. The provincial government under Doug Ford has been unable or unwilling to provide any details about what the expansion of the airport will do for air quality in Toronto. We've heard clearly today that airports are associated with increased rates of air pollution, noise pollution. Despite any claims about these new planes being clean and whisper quiet, we have no data to support these claims. And the plan to more than quintuple the number of passengers through the airport every year will impact air quality and noise levels of our city. Regardless of what type of new aircraft are brought in, expanding the current capacity of the airport by more have associated impacts on air quality and noise pollution via land transport. We all know that currently access to Billy Bishop is from one small street at the foot of Bathurst. How will we move 10 million people through that airport every single year? We will absolutely require more cars, more taxis, more buses, more trucks. Not only will more passengers use the airport, expanding Billy Bishop will require massive increases in staffing and in truck-based deliveries to service planes, terminal areas, associated outbuildings. What will this impact of more vehicles be to the community surrounding the airport? In particular, what are the impacts on the schools and multiple child care centers close to the airport? How will children and workers, both indoors and outdoors, these congregate care spaces, be impacted? The truth is we do not have any answers to these questions, as the provincial government has refused to do or share any research or risk assessment to address our valid concerns. As the Board of Health, I urge you to consider this motion before you and use every tool available to demonstrate the real impact of this expansion and the risk for Torontonians of all ages.
Thank you
so much.
Thank you. Any questions for the Deputant? Seeing none. Thank you so much.
Thank you.
Jeff Kettle, Tell, 3 minutes.
Thank you, Chair and members of the Board of Health. I appreciate being here today. It's a long time since I've spoken or been part of the Board of Health. Going back in time, I was a member for 12 years on the old East York Board of Health and chair for 4. So I have an understanding of the universality of your mandate and appreciate it very much. And I'm here today representing the Federation of North Toronto Resident Associations, FONTRA, which is a nonprofit volunteer organization comprised of 35 member organizations in North Toronto and North York. Our members associations include at least 250,000 residents within the boundaries. I'm here, frankly, to say, not on the technical side, but to say we are one city. We've heard lots today from local people affected immediately, but beyond that, this is an issue for the whole city. We are one city, we're brothers and sisters together, and we share the pain that some have directly felt in their lives, as we've heard today in some of the testimonies. The FONTRA, we spoke at Planning and Housing the other day, and we're strongly opposed to the proposed expansion of Billy Bishop and the introduction of commercial jet aircraft on several grounds, many of them being related to the health impacts. For this reason, we strongly request that you, as a board, concur with the City Council motion that they sent you and direct the Medical Officer of Health to a number of things, but to work with Health Canada to conduct a comprehensive study of the potential health impact of jets in proximity to Billy Bishop Airport, including an assessment of the burdens and costs to our public healthcare system. And this, in fact, would be an update of work that you, Public Health, did in 2013. What's happened in the meantime since 2013 is a greater awareness of these ultrafine particulate matters, as has been mentioned. These stresses which deal with cardiovascular and respiratory diseases. You provided excellent input to city decision-making back when this expansion was considered, a smaller form of expansion, was considered previously. The 2013 report on the health impacts directly led to the board recommending that the expansion of Billy Bishop and the introduction of jets be rejected at that time. Since then, of course, the plans are way bigger, and there's new research on the issues around ultrafine particles.
Please. Yeah.
And so we basically would recommend that, as I say, you work diligently with Health Canada on updating this 2013 report.
Thank you so much, Jeff. Any questions for the deputant? Seeing none. Thank you so much. Charlotte Duffy, online.
Hello.
Hi.
Can you hear me?
Yes, we can. 3 minutes. Go ahead.
Thank you. Thank you for letting me speak. I'm a resident of Arcadia. I've been here for 35 years. I've raised my family here. About 8 years ago, my husband developed some respiratory problems and had fluid on his lungs. He went through all of the tests. They really couldn't figure out what it was. They thought it was some obscure virus. After about a month or two, the symptoms disappeared. But sadly, a year later, he got diagnosed with stage 4 pancreatic cancer and died a year and a half ago. My friend died the year before of pancreatic cancer, and she was a yoga teacher. We're talking about people that were extremely health conscious and aware of, how important it is to live a good, clean life. But yet they're no longer with us. I believe it has a lot to do with the fact that we live under the Gardner Expressway and in front of an airport. And the thought of expanding this airport sounds and feels ludicrous. That the studies, we're talking now about 300,000 people being impacted by this expansion. How's public health going to deal with the decline of all those people's health? Personally, I've been affected because my anxiety levels are elevated, just thinking about the fact that this could happen. I think I speak for a lot of my neighbors. And because we are artists, I don't have the resources to pack up and leave and find another place to live, because this is an amazing place to live and there's not enough housing available for people like us. So I urge you to do whatever you can to make sure this does not happen. Thank you for letting me speak.
Thank you so much for sharing. Any questions for the deputant? Seeing none. Thank you so much, Charlotte.
Thank you.
Next up is Chris Glover, Member of Provincial Parliament for Spadina Fort York. I did see Chris here earlier. You know what? I'll. It's okay. I will get back to him. Ron Jenkins. Just plug it in. Okay, 3 minutes. Go ahead.
Yes, I'm speaking both as a member of the National Yacht Club and also a representative of Waterfront for All, which is a collective of about 25 waterfront communities. But I want to focus specifically on the sailing school at the National Yacht Club, which is adjacent to the Billy Bishop Airport. I'll compress 140 years of history into 5 seconds and say that the club has been on the waterfront since 1890. This is the club the year before the airport opened. And this is 70 years ago, the first year of the sailing school. Current uses on the waterfront are twofold, really. The sailing school operates in 2 areas of the water. And the older students sail off Hanlon's Beach. The younger students are right in front of the club and right beside the airport. So they're 180 meters from the runway. I mean, they could take an apple and throw it and hit a plane if they felt. Well, I'm not recommending this, but you know. on the land, they're 150 meters from the taxiway. So this you don't get closer than this. This is the expansion proposal, which runs right through that area. The Golder Associates report in 2013 was very good, but it did, I thought, include a deficiency, and I'll show you what it was. Looking at the risks here and here, specifics don't matter, but what I noticed was how it was drawn. The risk contours don't extend over the water, as if boaters don't breathe, people don't go into the water. And as a result, you know, these boats are launching 175 meters from the runway. Learning sailors can't be expected to stay out of the water. The report at the time said surface runoffs from point and non-point sources from airport operations may contain metals, oils, greases, hazardous materials, etc. Additional risks we've heard lots of already, so I conveniently didn't put a slide about those. But I did also notice that the noise profiles were doing the same thing too. And as far as noise goes, we're discovering health impacts for noise, not just loudness. And one other risk, I'm assuming I can call it a health risk if drowning is a health risk. The proposal in 2013 identified jet blast as a risk that needed mitigation. Yep. And the proposal...
Yeah, thank you. You are at time now.
Already? Okay.
Yeah. Okay.
That's too bad.
Go ahead, Councillor Thompson.
Can I just ask you about the proposal?
Yes. The proposal suggests a mitigation of a jet blast deflector like that, 20-foot high. But that jet blast deflector does not, as the environmental assessment says, protect all boats. So it could still cause small recreational boats to become unstable, be at risk of capsizing. And it also says that there's no mitigation available for boats in that category because they can't expand the marine exclusion zone. So the best they offer here is to post a notice indicating that small boats have to basically watch out.
So boats are at risk as well, in addition to the overall issues we've heard from all the speakers about the health and well-being. It's the usage. I had dinner last night at Harbor Square at 99. I was up on the 22nd floor, my old residence, and looking over all the boats, like traversing and so on. In the Mez area, I saw that, and some of the residents were asking me about that area and so on. So it hadn't occurred to me, though, about the effects of the jets coming in, obviously, on the boating population. We have significant amount of water taxis and all of those types of activities taking place. So this would have a dramatic impact on the the movements of the boats in the harbor then.
It's a navigational impact and it's a safety hazard. It's two of those things.
So when we talk about, the economic viability and the economic impact of having jets in the area and the reasons for this effort by the provincial government, we ought also have to look at the other impacts. And I think that's part of the issue that you're raising with us today.
Yes, I'm broadening it a little bit beyond the very narrow definition of health impact, but I was saying that a safety impact is a health impact.
Of course. Yeah, and with respect to the school itself, how many young people or how many people are using the school? How many students are coming to learn how to sail?
Right. It's first of all, it's open to the public. You don't have to be a yacht
member
club
of the yacht club.
No, anybody can send a child there. And in fact, there are adults that learn to sail programs as well operating. But as far as the children go, probably you would have about 500 or 600 going through in the course of a summer.
there are 20 boats, and some of them hold 2 or 4.
And can I just ask you another question? I don't know where I am in time.
You only have 5 seconds.
Okay, in my 5 seconds. The runway that's being proposed, can you speak to that as a boater because of the impact of the runway?
Oh, well, yeah. I mean, going a little bit outside, again, the health issues, that particular design of runway would probably make getting to the lake from the National Yacht Club and the Inner Harbor Clubs impossible through the Western Gap. They would need to take the Eastern Gap. So from National Yacht Club's point of view, they'd become a cul-de-sac.
Great. Thank you, sir. Thank you, Mr. Chair.
Thank you very much. I see MP, Member of Provincial Parliament's Spadina Fort York, Chris Glover's in the room. Welcome, Chris, to committee, Board of Health.
Middle seat here?
Yes.
Well, it's nice to be back.
Okay. Felt like you never left. Make sure the green light is on your mic and you can speak.
There we go.
There we go.
Okay. Nice. Okay, so it's nice to be back. I'm MPP Chris Glover. I'm the MPP for Spadina Fort York, which includes City Hall here. Before that, I was the school board trustee in the Etobicoke Centre, and it was the education rep on the Toronto Board of Health from 2014 to 18. Let's see, I'm just coming to support and ask the Board of Health, the medical officer of health, to move as quickly as possible in doing an assessment on the health impacts of the expansion, the proposed expansion of the Billy Bishop Airport. I know there's no formal proposal, but we know enough for the medical officer of health and the Board of Health to move ahead with this study. We know that the Premier is proposing to increase the number of passengers from 2 to 10 million a year. We know that he plans to implement Bill 5, which would exempt the project, the expansion, from all provincial and municipal laws. So the report that the Board of Health provides, or that the Toronto Public Health provides, may be the only health impact study that the people of Toronto get on this expansion. We know that the plan includes having jets land or take off every 2.5 minutes, and that there's a 900-meter runway extension, as well as 1.4 kilometers of runway lighting that would be necessary to make this happen. We know from a previous environmental assessment that a much smaller extension would have reduced the water flow through the harbor by 45%. So this will definitely impact the water flow through the harbor and increase the concentration of pollutants. I would ask that the medical officer of health in the study consider a number of factors. One would be the stagnation of the harbor water. The other would be the air pollutants, including sulfur dioxide, nitrogen dioxide, and ultrafine particles. There's also three chemicals associated with airports: the fuel spills, de-icing fluid, and fire retardant. One of your deputants mentioned that in 2005 there was a fire retardant spill at Pearson Airport, and it ended up being 6 meters high and covering 2 football fields. And this includes PFAs, which are forever chemicals, incredibly toxic chemicals. At Pearson, they have a separate, that's 4,600 acres, they have a separate storm sewer system, so they're able to clean the water before it gets into the regular system. At Billy Bishop, this would likely end up in the lake. I'd also ask that the study include noise impacts and the safety of high-rise buildings which are in the prime hazard zone, and a particular focus on the 5 schools. So Transport Canada defines an area around the airport as a prime hazard zone, and that includes 5 schools, including the Waterfront School and the City Alternative School, which are just a few hundred meters from the airport runway. It also includes the 80,000 residents along the waterfront and 28 million visitors. And I would like to say more just about why this is so urgent, but I'm out of time.
I'm sorry.
Yeah.
Any questions for the deputant? Seeing none. Thank you so much, Chris.
Okay. Thank you very much.
Yes, it's been a long day for all of us.
Yes.
Just want to say to the members, we are in danger of losing quorum around 3:30. So we are making calls, trying to see if we can actually get some more people here. Otherwise, I don't want to lose quorum, and then, the items that are coming up are in danger of not going through the Board of Health. Okay, so next up is Mason Fitzpatrick. 3 minutes, please.
Hello again, Chair and Board. Mason.
Make sure the
I pressed the button, didn't I?
Okay, you did. Okay, here we go.
Hello again, Chair and Board. Mason Fitzpatrick, Director of Communications at the Federation of Metro Tenant Associations. I'll be quick. I don't want to detain you too long. I just wanted to talk about quickly how, as an organization that serves and represents tenants in the thousands across the city, including along the waterfront, we are very excited that the city is going to be looking into the health impacts of this and strongly support the recommendations as written, although with a slight suggestion that I would offer, which is to consider, as you did in the previous motion, 34.4, which was just passed, to incorporate a communication strategy and knowledge mobilization strategy that is going to make sure that the results of this study are communicated to the broader public. I think this is especially important given political dynamics at the federal and provincial levels, and the fact that the federal government holds so much sway over the Port Authority with 7 seats, as opposed to the province's 2 after they've taken over Toronto's seat. I also think it's worth noting that the federal government currently governs with a very slim majority in Parliament, and so it is compelled to make concessions to minority elements of its coalition that would otherwise be less empowered. And so the impacts of communicating the results of this study and in engaging community throughout the process of this study are going to have much more purchase than they otherwise would. Even just the title of this motion, which is investigating, the risk of lung cancer, heart disease, and tumors. When you hear that, it just, it gives me a little chill just even to say it out loud. And people are going to be freaked out when they hear this. And I think that actually plays to the city's advantage if they want to use this to throw a wrench in the development. Because if this could be communicated to the public, especially in communities along the waterfront, members of Parliament are going to be more hesitant to be associated with this and are thus going to advocate to the federal government by their own volition to delay or disrupt this project. And so I would recommend that in the course of this study and in the communication of the results, that the city and the medical officer of health consider how to partner with community organizations, engage with tenants, engage with residents, and make sure that everybody knows what's going on. The Prime Minister has stated that he has not made up his mind about this issue. I think that if this study is done correctly, we can help him. Thank you.
Thank you very much. Any questions for Deputant? Okay, thank you. Mason Fitzpatrick, are you here?
That was me.
Oh, sorry. Thank you. Louise Hittinger.
Hi there. Can you hear me?
Yes, 3 minutes. Go ahead.
Okay, I'm just going to share my video, share my screen. Can you see it?
Yes, we can.
Okay, wonderful. I'm just going to jump right in. I'm speaking on behalf of Clean Indoor Air Toronto. And although we are focused on indoor air quality, we're also very concerned about outdoor sources of outdoor pollution, because outdoor pollution comes indoors. And we speak of emissions as this benign thing, but it is made up of a complex mixture of chemicals. There has been a lot of talk about the UFPs, and we know UFPs come from jet engines, and is specific to them because of the specific reaction conditions inside a jet engine, the very high temperature and high pressure that is capable of vaporizing jet engine oil. And so these tiny particles are so small that they can pass quite deep into body tissue once it's inhaled. This is a modeling study that was done by, it was a joint modeling study done by researchers from U of T and McGill, showing how UFP from aircraft travels quite far. This is a whole city problem. Certainly it concentrates over the downtown area, but you'll see there's pockets of red through Scarborough, through the West End. And this is not particular to Toronto. This has been seen with airports around the world. And as I was saying, outdoor becomes indoor air, And it's a real issue because we spend 90% of our time indoors. Our main route of pollution exposure is through breathing. We breathe approximately 11,000 liters per day. Now, the unfortunate thing is that our current ventilation standard, which is part of the Ontario Building Code, which is called, and so this standard is called ASHRAE Standard 62.1, it's not designed to handle fine particulate air pollution, including UFPs, and it's not designed to handle airborne disease transmission. And so thing is, many buildings in Toronto they don't comply with current ventilation standards. They lack adequate ventilation, adequate air filtration, and air conditioning. And so we need a minimum of MERV 13 or higher, plus in-room air cleaning to adequately remove these pollutants from indoor air. But the thing is, most houses and residents and buildings don't have this type of filtration. So we're calling on Toronto Public Health to prioritize a healthy city. And much has been spoken about this. We've pulled a quote here from the 2013 Toronto Public Health study, which says the current vision of the city's official plan is a densely populated, vibrant area that aligns with the characteristics of a healthy city. And so we're calling on Toronto Public Health to apply the precautionary principle. There's been a lot of talk about, more study is needed, et cetera. The thing is, we have all the information that we need right now from the 2013 Toronto Public Health Report, the 2017 Environmental Assessment, and this most recent report by city staff that was presented to Planning and Housing Committee. So I've placed this quote here to describe what the precautionary principle is and hope that it'll be applied here.
Thank you so much. Any questions for Deputy? Saying none. Thank you. Ann Davidson. Ann Davidson? Not online, not in the room. Okay. Norm De Pasquale? Online? Norm, can you hear me? Norman Pasquale, just unmute yourself. You there?
Yes, hi, I'm here.
There we go. 3 minutes. Go ahead, Norm.
Good day, Chair, members of the board. My name is Norm DePasquale. I'm speaking on behalf of No Jets TO, an organization that aims to preserve our revitalized, mixed-use, balanced waterfront by saying no to jets that would wreck that balance. First of all, I want to thank Toronto City Council and the Board of Health for considering conducting an updated health impact assessment for the Island Airport, including the proposed jet expansion. Thank you for putting Torontonians' health first. I want to put a fact on the record, which is a key reason why I'm so passionate about saving our waterfront for jets. Of every major airport in Canada, the Island Airport is the only one with K to 12 schools within a kilometer of an active runway. And not just one school, but three: the Waterfront School, the City School, and the Island Public School. All three were identified as sensitive institutions in the Toronto Port Authority's own 2017 environmental assessment of jets. As a leader of the No Jets TO fight, I was inspired to join this fight to give voice to our young students who are unable to speak up for themselves. They deserve a safe learning environment that's free from excess pollution, which studies have shown affects their ability to learn and retain information. I also want to speak to the importance and urgency of this health impact assessment. Just as Toronto has shown they belong in the tripartite agreement as a local municipality, Toronto Public Health has shown that they best understand the health context and health needs of Torontonians. Toronto Public Health produced a comprehensive and influential report on the health impact jets would cause back in 2013, which really helped center the conversation around jet expansion around the health of Torontonians. Looking at the other levels of government who one might hope would conduct a health impact assessment of jets, the province has announced they plan to strip our environmental rights and protections around the airport through Bill 5's special economic zone designation. And I'm concerned the federal government might do the same through Bill C5. Toronto Public Health may be our only hope for a health impact assessment of jets. That said, I do support requesting the other levels of government to do the right thing and perform a health impact assessment. With respect to timing of a Toronto Public Health jet impact assessment, I'm also concerned we're entering into an election blackout period where councillors may be unable to move motions and direct staff, and the proponents of expansion may use this period to try to steamroll expansion of the Island Airport. It's my belief that Toronto Public Health should get started on this work as soon as possible, as proponents of expansion are being extremely opaque about plans and timing. Furthermore, there's a strong foundation for this report between the various other assessments that have already taken place up to last year's ultrafine particle study. The same way city staff leveraged the 2017 EA to respond to city council questions, these previous studies provide a strong foundation to assist with getting started now. I support city council's motion for a health impact assessment, as well as calls to get started as soon as possible. Thank you.
Thank you, Norm. Any questions for the deputant? Seeing none, and that was our last deputant. We're going to take it in-house now. I see Deputy Mayor Malik is here. Any questions for staff? Let's just speak. No one to ask questions. I do have a few questions. It's in front of me. So quickly, I know we're running out of time. Do we have enough information to conduct a health impact assessment today?
So thank you, Chair. I think many of the deputies have spoke to the 2013 assessment that was done at the proposal at that time that already said, and my predecessor indicated, that the most healthful use of that space would be a park. So the ideal would be in 2033, when the tripartite agreement would have ended, that it would stop being an airport. So I think from a health perspective, that's the most healthful use of that space. For us to move forward now on a proposal, I think our challenge is there's been a lot of rhetoric around what that proposal might be. Is the 10 million flights and people realistic, or would the plan change? Would the actual plan that comes forward be different than that? And I think that we would want to do the health impact assessment on what the actual plan is moving forward, which we have not seen. So I think our goal would, to have the most meaningful report would be to wait till we actually had that proposed plan in hand to be able to do the health impact assessment based on that actual report.
Okay, thank you. And at the Planning and Housing Committee in June, the Waterfront Secretariat was able to provide a model of impacts related to traffic and congestion based on existing information. Why can't TPH do the same but related to health?
To you, the chair, thank you for that question. The reason, there's several reasons actually why we can't just undertake that modeling. Our traffic department actually has many models available to them. And just to give you some context, for the 2013 study that was done, it actually took 2 years to develop that model. And we ended up piggybacking on that model that was meant for other study purposes in the to study in the city of Toronto. So we would have to actually start a model from scratch. And there's a lot of inputs that go into the model. And as Dr. Murdy had indicated, there is still a lot of rhetoric, but not specifics. And you really, if you want to make this a meaningful and actually as accurate a possible study, you need to have all the specifics. So what are the type of aircrafts, the fuel that will be used, the length of the runway, mitigation strategies. So for example, from the 2013 study, it demonstrated that there was significant air pollution caused by the diesel-powered ferry, and by electrifying that and creating of the tunnel, we actually improved air quality significantly in the area. So until we have all of that, it's just not easy for us to do that modeling. And I should also stress that type of modeling can't be done in-house at TPH. It would have to be contracted out.
Okay, thank you. And can you speak to the study that was conducted in 2013? What were the findings there?
Do you want me to, or do you want to take it, Michelle? I'll take it. All right.
Yeah, I think as I said to the chair, at that time, the proposed changes, would have health impacts in terms of increased noise, increased air pollution from the jets that would have been at that proposed then. And the recommendation was that on balance, the most efficient use of that space would be eventually decommissioning the airport to move away from having an airport at all at that space to have the most health-based outcome for that land use. So I think that we're now, we had a proposal then. Certainly technology has changed from 2013 till now. The types of jets that are available, then versus now might be different. So again, we would be concerned for sure that any expansion of this airport is going to have that potential to increase noise, to worsen air pollution, to change land use in a space that is not health promoting. I think our concern would be, using the 2013 scenario may not be the plan that's being put forward now, and we would want to be able to, best reflect the health impacts of the current plan.
Okay. You may have answered this, but I didn't understand. So, no, I have 5 minutes.
3 seconds. No, you don't get 5 minutes. Everybody else doesn't get 5 minutes.
The deputies get 3 minutes. The
what are you
committee
talking
gets
about?
5.
We've been having 3 minutes all day, Chair.
All right. Okay. That's enough. Do you have a question, Councilor?
I do, and
okay,
I want to
go
get
ahead.
on with you. You said we have a timeline for 3:30.
Sorry,
I didn't mean to.
No, it's
basically...
okay. It's all right. Go ahead. Go ahead. Ask your question.
Just so thank you through you, Chair. So ideally, it would be best if we had all of the information, all of the details as it relates to the definition, the airport, and how large the jets are going to be coming into the airport, the overall impact, both in terms of environmental and all the other issues as it relates to economic impact and so on. Now, I realize you're not doing an economic study, you're doing a health study. So it would be premature then for us to advance this, even with respect to the 2013 report, which I was actively involved with in terms of as chair of economic development back in that time. So I'm curious, how do we move ahead with respect to the interests of the public? Because we want their voices to be heard. They want us to action a report, but in order to action a report, the necessity of time and the accuracy of information and details in order for that work to have meaningful impact, how do we move ahead? Through you, Chair.
To the chair, I think that is a good question. I think certainly we heard a lot today about the concerns of residents in the area and even to the point of mental health impacts. Yeah. One of the components of 2013 was doing that community engagement assessment. So even without that plan, I think that, one aspect we could start to look at would just be the current concerns that people have about even the uncertainty of the expansion, so that there could be a component that we look at, not necessarily the direct health impacts of the change, but the more community level impacts. And then as we move forward to actually having what that plan is, we could look at what the more measured health impacts in terms of noise and air quality could look like.
So then we would do it in phases as such. So 2013, here's where we were. 2026, here's what we're going to do, pending more detailed analysis, more detailed information, pending the provincial government's decision, pending hopefully a federal government position, which I think we kind of know, irrespective of what the Prime Minister is saying. I didn't ask, you don't have to answer that one.
Sure. To the chair, I think that's an option for the board to consider moving forward. I mean, we have the motions in front. Certainly, I think the recommendations are ideally that the full impacts assessment is done by the province and feds, but that is a way that we can move forward in the interim until we have that.
And as we approach my 3 minutes, because I don't want the chair to come at me, I would
never do that.
in a friendly way, Mr. Chair. And we would actually have to retain the services of outside consultants because we don't have the expertise in-house in order to do this real work. Would that be the case?
Yes, that is correct. As previous respondent, I think that as that was done in 2013, all of these would be externally contracted resources.
Thank you. Thank you, Mr. Chair.
Thank you. Any further questions? Seeing none, we'll go to speakers. I see Deputy Mayor Malik is here, wants to speak to this item. Go ahead.
Thank you very much. I want to begin by thanking community members and advocates and experts who took their time to speak to us today, who have been communicating with the Board of Health and also with many of our offices about the concern for Torontonians and the health impacts of the island airport expansion that we are seeing and the potential harm that will be caused by the information that we have publicly available and what is being speculated in a proposal. We know that we are faced with these very immediate, urgent, and troubling questions because of the unacceptable choice of the Premier to remove the say of the people of Toronto over the future of the Island Airport. And I have been clear, and City Council has been very clear, that Torontonians deserve a say on the future of their city and of their waterfront. And as a local councillor for the Central Waterfront, I firmly believe that we must build a city and a waterfront where people can be healthy, to live, work, learn, and enjoy. And any discussion of the changes of the Island Airport must align with the city's vision for a vibrant, livable, and sustainable waterfront. And at the core of that is the health and well-being of people of our communities. And that's consistent with how the city and the federal government have successfully worked together for decades to make decisions on this important site. And I have called alongside my City Council colleagues and community members for the federal government to use their powers, to use every power that they have to stand with Torontonians against this provincial overreach and in the interests of our shared well-being. And any decisions about our waterfront's future must be transparent and evidence-based, and that is what is being called for today, and that I've been actively supporting for years since my time as a school board trustee representing this community. And I want to especially thank the collaboration of the Bathurst Ski Neighbourhood Association, along with the University of Toronto, city staff, and even the Toronto Port Authority in the work that has been done over that very important and landmark study around air quality in this area, and the depth that it allowed us to understand the cause of ultrafine particles from the Island Airport and their presence in the community that is steadily increasing, and the seriousness of their harm. And one of the key recommendations out of that study was for ultrafine particles to be included in air quality standards. And I'm proud that in May, City Council adopted my motion to request that the Government of Canada update their air pollution regulations to include these safety standards for ultrafine particles. A comprehensive assessment of all health impacts, including ultrafine particles, must be part of a review of jets and other changes to the Island Airport. I want to give my sincerest thanks to the chair for his coordination with my office to refine the direction in this motion before us, to ask the federal and the provincial governments to undertake these health studies alongside us, along with our own Toronto Public Health Review, with costs to be borne by the proponent. And this is very important, and it is incredibly urgent for the well-being and the health of Torontonians, and knowing that this issue is coming up very quickly, and then the impacts will be felt very deeply. I urge members of the board to adopt the recommendations, and thank you for your time and your attention and your care today as well.
Thank you very much, Premier Malik. Any other speakers on the item? No? Go ahead, Councillor Thompson.
Thank you, Mr. Chair. Obviously, we recognize the necessity of having solid information, and information as it relates to the overall health and well-being and the facilitation of expanding jets at the Island Airport. While it isn't the theme and or the desire of the residents in the area and many Torontonians, nonetheless, it is a provincial government's mandate and position that be done. I think it's really important, though, that we have discussions and we have consultation, irrespective of whatever sides you're on, particularly as it relates to the health issues associated with the commentaries that we've heard from all the people who have actually come in here today, who are saying, look, this is a problem. There's health-related issues, and there are other issues as well. I particularly am pleased with the gentleman who came from the yacht club and provided us with some additional information, because I think this is all very important, and it really speaks to the complexity of the issue. And the fact of the matter is that it's just not simply an NIMBYism approach with respect to this idea. And I do think it's important for us to listen. At the end of the day, whatever the decisions are made, it will be the decision that's made, but to take into consideration the importance of the issue. Now, we are saddled, and unfortunately, between a rock and a hard place, as we've heard from Medical Officer of Health. If we are to pursue this study and bringing back accurate information that's helpful to decision makers and so on, it's problematic because of the fact that what exactly are we studying? How are we studying it? Where are the jets and what types of jets are going to be coming into our inner harbor, into our city? And at the same time, the cost of doing it, and I don't think that's the big factor, quite frankly, whether or not the city has to pay for it or someone else. I'm not sure that the Port Authority or others will pay for it. Nonetheless, it's something that should be done. But I do think we have to ensure that we have all of the pieces that we want to analyze, as opposed to trying to analyze something without all the pieces, because we won't get accurate information. Although it may be pleasing to some to understand we're going through the exercise, we ought not to go through the exercise just for the purpose of going through the exercise. We have to go to the exercise in a very diligent way, in a way that thematically will actually bring us information that helps us to understand all of the underlying issues, health-related and otherwise, that people are concerned about and so on. So I'm going to support it, but reluctantly, because it's not accurate, and I hope that it's phased in a way that's helpful. 3 minutes, Mr. Chair.
Thank you, Councillor Thompson. I may take 5, we'll see. I do have a motion. Again, a lot of people helped with this motion. A lot of eyes were on this. And again, thank you to all the deputants for, their deputations and testimonials, and personally and by extension, how this impacts our communities, our city, I'm going to say, and beyond. So I'm going to read the motion because I think it's important to just put it on record out there as to what it is we're trying to do here. Because again, we do have limits as to what we can do in this city, on this board, in the city. And so we're using all the tools available to us to try to, make sure that our voices are heard. And so number 1 says, the Board of Health requests the Government of Canada and the province to ensure that any proposal to expand operations at Billy Bishop Toronto Airport be subjected to comprehensive assessment on the potential health impacts, including introducing jets in close proximity to residential communities, potentially increased noise, increased traffic, and air quality impacts, including ultra-fine particles resulting from the expansion. And again, we heard that through the deputations here today. Number 2, the Board of Health requests the Medical Officer of Health, Dr. Murdy, to offer support for the federal and provincial government's assessment of the potential health impacts of an expanded Billy Bishop Airport when sufficient information, this is important, when sufficient information regarding proposed changes to Billy Bishop becomes available. Because right now we don't have enough information to actually assess. 3, the Board of Health requests the MOH, Medical Officer of Health, to assess the potential health impacts of the proposed expansion plans for operations at Billy Bishop Airport, including introducing jets in close proximity to residential communities, potentially increased noise, increased traffic, and air quality impacts, including ultrafine particles resulting from the expansion, and this is important, when expansion plan proposals are available, for review and assessment, and report back to the Board of Health with the outcomes of this assessment. And lastly, the Board of Health requests the Toronto Port Authority to fund Toronto Public Health for the assessment of health impacts related to the proposed expansion of the Billy Bishop City Airport. So again, this is within our purview, and we're pushing the boundaries, right, at all levels to make sure that our voices in the city are heard. And again, thank you to all the deputants, and thank you to Torontonians in general who've actually reached out to all our offices asking us to actually speak out on this item. And I feel that we are, to the Deputy Mayor's point, both at Council and here at the Board of Health. And with that, I'm going to ask for a vote on this item. All those in favor? Opposed? Carried. Thank you very much. The next item I think that's, what's the next item? I know that time is of the essence here. So the endorsement of the Council of Chief Medical Officer of Health position statement on digital culture and child and youth well-being. I think Councillor Churnos-Lynn, any questions of staff on this item? Seeing none. I see Councillor Churnos-Lynn, I think you have a motion on this item. You want to speak to it?
I do. I think it's up on the screen. So I just had a small amendment to, and this is something, so I had two asks, and I can't really tell from this motion, but I would just confirm with clerks that we've added somehow a link to the statement position. Yeah, that's been added. Okay, so that was one of the things I wanted to see added, just so that the public, if they look at this, will be able to find the position paper and read it. And then the other thing was just to draw out an acknowledgement of the risk of early exposure to exploitative marketing. Particularly, we've seen a major rise in online gambling among young people that is having really deleterious effects and really substantial impact in a variety of different ways. And I wanted to make sure that was captured, as I know it was captured in the position statement from the boards of health. So I just wanted to make that clear. But otherwise, I am happy to see this brought to the Board of Health.
Okay, thank you. And I'll just say quickly that, other jurisdictions internationally have actually addressed this. They're starting to address this. We see the harm that's being done to young people. And I really think, it's important that we here in Toronto also address this as well. There are many former trustees in the room here before now, even Councillor Johnston was chair of the Board of Health for some time, Toronto Board of Health.
I was never chair of the Board of Health.
No, sorry, chair of the Toronto District School Board. Thank you for the correction. And so, again, we care about our young people in this city, and we know that this is affecting their well-being. So we'll put up Councillor Johnston's motion on the screen. It's been a long day. All those in favor? Opposed? Carried. Item is amended. Item is amended. All those in favor? Opposed? Carried. Thank you. And the last item is declaring the drug toxicity crisis and epidemic. I had questions, but because in interest of time, I will just speak to it. Any speakers, questions of staff? Any speakers on the item? Okay, I'll just say quickly that we have seen an incredible uptake of opioid overdoses across the city. I actually am able to speak to various community organizations, and they've told me firsthand how they're impacted by this. Their staff is actually experiencing burnout, and people are just emotionally and physically exhausted. This is really, really hard work. I see the reports every month as to the increase of people overdosing across the city. At one point, there was 15 overdoses in one park in one day. That's quite extraordinary. And talking to paramedic services, they've told me that, they are actually overwhelmed. In comparison, for example, in April of last year, to this year, there's 485 non-fatal suspected overdose doses in the month of April, which is a significant increase. And that doesn't even capture the entire story, because I know of cases where people have overdosed and people help, but it's not reported to public health. So that number is a lot higher, that I'm sure. And if our emergency services are actually helping people on the streets who are overdosing, that means that if someone has a heart attack or a stroke or something like that, then they can get to them in a timely manner. Because if we don't have supervised consumption sites in certain places in the city, I think we only have 2 left, then the entire city is a SCS site, because everyone is trying to help on the street. And of course, that impacts what happens in our emergency rooms. Because talking to, the hospitals, they're saying that they too are overwhelmed as well. And it's only going to get worse. It's only going to get worse. And so I do hope the province is seeing the stats that we're seeing. I'm assuming this, we collected at the city, but I'm assuming they see it too. And I'm sure you've seen all the commercials on television saying how great things are, right? And you know that's not accurate either. So anyways, and I think, speaking to various organizations and even public health staff, they feel that declaring this a epidemic at this point in time is reasonable. So I do hope my colleagues on the Board of Health do support this motion that's before you. I will not read it, but it's here for the public to read. What is this? Oh, yes, that's right. And I have a second motion on behalf of Dr. Zhao, Director Zhao. She wanted to add, you want to put it on the screen? And people who use drugs. She wanted to add that in there because she wanted to capture that as well. So with that, I'm going to ask that we vote we'll vote on my item.
See that? Is there a way to enlarge that?
Could you enlarge for, get back on the screen and enlarge that? You want me to read it? I can read it if you like. That the Board of Health amend recommendations 3B, so it reads as follows. Board of Health requests the province to fund the healthcare-focused response to the drug toxicity epidemic in Toronto through increased funding for a broader range and increased availability of evidence-based opioid use disorder treatment options, withdrawal management services, ongoing stabilization supports, and B, low barrier community-based healthcare supports for those who are underhoused. Example, increased community paramedicine, healthcare providers, drop-ins, and added people who use drugs. And C, additional street outreach and drop-in staff supporting increased needs in those communities stemming from the sudden closure of supervised consumption sites. Okay, all those in favor? Opposed, carried. And my motion? No, I guess. Item as amended? Item as amended, all in favor? Opposed, carried. Thank you, everybody, for your work today and your participation. And to staff, thank you. And to the clerk, thank you. And her team, you guys are awesome. And have the rest of a wonderful day. Take care, everybody.
What? But we're missing so many people. We're missing so many people.